Well, good evening, everyone. I would like to call to order this legislative meeting of the Board of School Directors in the Upper Dublin School District. It is Monday, September 21st, 2020, 7 p.m., and we are meeting via Zoom. If I could, I would love to begin our meeting as we always do with the Pledge of Allegiance for board members, if you can unmute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everybody. I know that's not the easiest thing to do, but I appreciate it. This evening, I would like to just keep my welcome very brief because we have a few important. Oh, yes.
I apologize.
I'm sorry. No, you're right. Ms. Evans, I was getting ahead of myself. Ms. Evans, roll call, please.
Dr. Davis.
Present.
Mr. Henderson.
Present.
Ms. Ionetti.
Present.
Dr. Levinowitz.
Present.
Mr. Ropsky.
Present.
Ms. Sherpier.
Present.
Mr. Sirota.
Present.
Mr. Wallach.
Present.
Ms. Franczyk.
Present. Thank you, Ms. Evans.
Thank you.
So as I said, I'll just keep my remarks very brief this evening. First, I would like to extend our best wishes for a Happy New Year to our community members who celebrated in the Jewish community who celebrated over the weekend. And I also wanted to, as I typically do, try to once again thank our staff and administration. We're now into the school year and really seeing the creativity, the flexibility, the resilience, and just the skill of our staff. And I just can't thank them enough. I also want to thank each and every parent, grandparent, caregiver, person who is supporting the students as they participate in the Cardinal Academy. We know what a Herculean task it is. I actually spend 4 or 5 hours a day beaming into homes in my job for students who are K to 6, and it's homes and daycares and pods and grandmom's house, and I've really gotten to see so much special work that's happening, challenging work that's happening. We recognize that it is a lot, it is exhausting, but we are in it together and we continue to remain committed to doing all we can to support you. So thank you. That said, I would like to turn it over. We do not have this evening a Student Government Association report, so I'm going to turn it over to Dr. Yanni.
Thank you, Mrs. Franczyk, and hopefully next month our student representative will be identified and that student will join us moving forward. Good evening, everyone. I hope everyone in our community and everyone that's listening is doing well. I wanted to let everyone know that the blueprint for resuming in-person instruction that we previously released, we are considering this a living document, and that means it's subject to change as we move forward. As many of you know from looking at tonight's agenda, the board will consider a motion to resume in-person instruction for 2 groups of students. The first group of students being our kindergarten students, and the second group of students being our students in special education who spend most of their days in our special education programs. For the first time since the debut of the COVID-19 data dashboard provided by the Pennsylvania Department of Education, the positivity rate in Montgomery County has declined. For the 7-day period that ended on September 17th, the positivity rate for Montgomery County was 3%. Tomorrow's Touch Base Tuesday will contain full metrics, but I want to walk through a few changes to our blueprint, this living document. So on tonight's agenda, the board will consider action to resume in-person instruction for kindergarten and some of our special education students. If that motion or if those motions are approved, then tomorrow we will begin surveying our kindergarten families, and our student services department will be doing individual reach outs to families of students in special education who we're transitioning back to school. We are going to accelerate surveying the rest of the community. That was moved up. So next week, we will be surveying our families in grades 1 through 12. And part of this survey is also going to be looking at asking families if they are going to have their children take advantage of our transportation, or if they are going to transport their children themselves. We're going to continue releasing Touch Base Tuesday communications to keep the community abreast of all of the developments. And in tomorrow's Touch Base Tuesday, we're going to be sharing specific information about the quality of masks and facial coverings that we should be wearing. In addition, we will share tomorrow the warehouse where we're putting all of our Touch Base Tuesday and coronavirus communications. Along with the survey that our kindergarten families will receive, will be explicit information about what children and families can expect when they come into our buildings. And as our student services department contacts and does those personal reach outs to families, they'll be sharing some specific information as well. While this is a move in the right direction, I know it's not the kind of movement that some in our community would like to see, but I want everyone to realize something, that once we open, if we experience a number of cases, the state has put out guidelines of when we need to change our status from in-person instruction back to completely virtual. Much of those decisions are out of school district's control. And if you look at what happened last week in Souderton, there was a building, an elementary school with 2 cases, and our local Department of Health closed that building for a period of 2 weeks. I want everyone to realize that's not a criticism of our health department. It's not a criticism by any stretch of the imagination. But I do want to let everyone know that once we are back in, if we do experience cases, much of the decision making is out of local control and put in the hands of the Department of Health. I would also ask that we've had a steps of communication in place since 2018, and please refer to those steps of communication when reaching out with questions or concerns. In many cases, the questions and concerns can be answered by our teachers or our principals, and if satisfactory answers are not given at that level, then district office and finally the board would be very happy to answer those questions. My superintendent report will be out on social media following the conclusion of it tonight. And again, tomorrow's Touch Base Tuesday will contain much more information. We are very excited that 13 Upper Dublin High School students have been named 2021 National Merit Scholarship semifinalists. The local students were among some 16,000 students nationwide that were chosen from a pool of 1.5 million students. Students who took the 2019 PSAT were automatically entered into consideration. And from the pool of 16,000, about 7,600 will be chosen next spring as finalists. To move on to the finalist round, students are judged based upon an application covering their academic record, their leadership abilities, employment, participation in school and community activities, and honors and awards that they've received. Students must also write an essay and be recommended by a high school official. Over 90% of the semifinalists will be named as finalists for the scholarship, and of the finalists, about a half will win a scholarship. So we'll look forward to this spring when we'll have more information to share about our 13 semifinalists. This evening, I'd like to give a special welcome to Mr. Prakash Patel, our new Director of Innovation and Technology. We're pleased that Prakash joined us officially on the 10th of September. Prior to joining us in Upper Dublin, he served as the Director of Technology for the 21st Century Cyber Charter School, where he was responsible for all facets of the technology department. And in fact, he was the school's first ever technology director. By developing and implementing a strategic vision for his department, he effectively championed changes in curriculum design and instructional delivery. Prior to joining 21st Century Cyber Charter School, Mr. Patel spent 20 successful years in the Quakertown Community School District, where he taught both computer science and mathematics. He also, in his role, supervised the district's virtual high school program. We're very excited that Mr. Patel is with us, and we look forward to the community getting to know him very soon. If you've driven by our construction site at Sandy Run, you'll see that there has been tremendous progress made. Mr. Trantis recently shared another video of drone footage, a flyover, and I've put a number of pictures in my superintendent's report. The contractors are fully up out of the ground and are actually starting to put windows in the building and will be completely inside by winter. We're really excited for that. I also want to acknowledge a few additional points about our process to resume in-person instruction. For the last couple of weeks, there have been ongoing conversations with our community about the district's stance on transporting non-public students. I want everyone to hear again what we've been saying for a number of weeks. This decision to not transport non-public students at the same time that we were not transporting our own students was driven primarily by safety and the inability to distance students on transportation vehicles. If the board approves the motions tonight to resume in-person instruction on October 5th, we will then also begin transporting our non-public students on October 5th. On October 5th, when we welcome our kindergarten students back, it will be in a half-day scenario. So the morning will be primarily core academics, and then they will be released midday, and they will spend the rest of their day in the Cardinal Academy. They'll have their special and individual collaboration and check-ins with teachers. The same will hold true for our students in our special education program. Again, we want to wish all of our community members that celebrated this last weekend a Happy New Year. And just a reminder that schools are closed on Monday in observance of Yom Kippur. And we've put that out on social media, both on Twitter and Facebook, and we will continue to remind folks that schools are closed on Monday. Mrs. Franczyk, that concludes my report. Thank you.
Thanks very much, Dr. Yanni. Seeing as there are no presentations, no formal presentations this evening, that does bring us to our first session of community input. And what I would invite the community to do is in your chat feature to raise your hand. I can already begin to see folks doing that. And I will call on you in the order that your hand was raised. Hopefully the system will continue to show me the names in that order. I apologize if that doesn't quite work out, but I will do my best to keep everyone in the order that they came in. And what I would do is then I will not unmute you. I will provide you the option to talk, and then you will need to unmute yourself at home. And I just ask that everyone please state your name, where you reside in the township, and also adhere to the 4-minute rule in terms of timing of your comments. With that, I would like to begin. I'm going to open it up for Ms. Lisa Barry. And if you may unmute. Ms. Barry, do we have you?
Yes.
Very good. Go ahead, please.
Hi, good evening, everyone. My name is Lisa Berry. I live in Drescher, and I have two students that go to Jarretttown Elementary, a first grader and a fourth grader. I just wanted to first start off tonight by thanking the administration. I've had quite a few times of communication with the administration in the last few weeks, and I want to appreciate the openness and candidness of those conversations. I also want to thank the teachers that are on tonight as well. My sons have Miss Traber and Miss Shapiro at Jarretttown, who have been amazing. And I know that this cannot be easy for any of these teachers. Many who I know would actually prefer at this point to go back into school because it would just be easier for many. But either way, however the teachers feel, I just appreciate everything that they're doing. It's unbelievable. I agree with Dr. Yanni that at a minimum, the special ed and kindergartners need to go back. I also feel like the first graders should be in there as well. My son is a emergent reader, but still, it's just very difficult for them to navigate the computer all day. And my children go to a center that helps them. And I know that the center director spends most of her time, again, with the kindergartners and first graders, just because they really can't do it independently at all. So I hope that the first graders will soon follow the kindergartners coming back. I just had a couple questions also this evening, hopefully can be answered. It was brought to my attention today that the fourth grade classes at Jarretttown are over capacity. My son's class has 24, which is maximum, and there are 2 classes that are at 25. I'm not sure why the school allowed these 2 classes to be over capacity, but they are. And we are this fourth grade only has 3 classes versus most other grades have 4. A lot of parents feel that at this point we don't want to change classes, but I hope this can be corrected for next year. And I'm not quite sure why this was allowed to happen. Hopefully we can get those teachers that have 25 extra staff, either virtually or in person, to help them, because I don't think that's fair. And apparently they're the only 2 classes in all the elementary schools in the entire district that are over capacity. Also, I wanted to ask, when these classes come back, will teachers change, just so that teachers are either teaching in person or virtual? To ask a teacher to not only teach children sitting there as well as kids online, I just don't think makes sense. If children are in person, they should be doing in-person activities. If children are virtual, they should be doing computer activities. And I don't feel like asking the teachers to do both is fair to the teachers or the students. I also wanted to know if the survey results will be released to the public, how quickly the older students will be going back, as in first grade and above, and if there is a hybrid schedule, what will that schedule look like, as in Monday, Tuesday, and I guess Thursday, Friday. In closing, I just want to ask, please consider letting the kindergartners and special ed go back, as well as all the other students soon thereafter. And also, please consider changing classes so that teachers either have in-person students or virtual, but not both. I don't think it's fair to the students or to the teachers. Thank you very much.
Thank you, Ms. Barry. Next, I have Pam, I believe it's Tufel. I'm going to allow you to talk. And if you can unmute.
Okay. Hello, my name is Pam Tufel. I'm a resident of Drescher. I have a 4th grader who's attending school in my dining room, 7th grader who's attending school in my living room, and a 9th grader who's attending high school in her bedroom. I'm here tonight to ask you to reconsider your decision not to resume in-person school for first grade through 12th until November 9th. Dr. Yanni was very clear last week and again tonight that COVID-19 is here for the foreseeable future. He went further to say that when we resume in-person school, we will have a 100% guarantee to have one COVID positive person in every building. And then proceeded to detail how difficult it would be if we return to school, because when there's a positive case, we're going to have to close schools. As a parent sitting in the audience, it came across as a lot of administrative burden to have to manage the COVID situation. And as a hospital administrator, I certainly can relate to the challenges that COVID can cause. The key difference is that hospitals weren't allowed to close. We were considered essential. We managed over 200 employees who went out on leave. We surged up to 178 ICU beds when we normally have 30. And we discharged over 1,000 COVID patients in a span of a 3-month period. Since April, not a single employee at my hospital has contracted COVID at work. It's been challenging, incredibly rewarding. We figured out how to live with the virus. We're no longer paralyzed by fear or ignorance. My kids have watched me go to work every day and are very educated on this virus. Our family is confounded as to why in-person learning, teaching our kids, isn't considered just as essential. I agree with Dr. Yanni that we shouldn't compare Upper Dublin to private or religious schools. However, it's totally appropriate to compare us to every school district around us. Wissahickon opened K-5 from the start, and as soon as they have enough teachers, they've said they'll resume the rest. Jenkintown started in person and gave parents a virtual option if they weren't comfortable. Radnor started in person half days. Colonial is holding a special meeting tomorrow to vote to return earlier than November. Put yourself in our shoes for just a second, especially the board members that don't have kids in the district and are enjoying seeing their kids away at college. Please answer this question for me. What message does that send to us as parents and taxpayers of this district? That other schools are opening and we're not? Does it say that they're uneducated and we're the only smart district in the state? More importantly, what message does it send to the kids of this district? It sends a message that your administrative burden, the risk, the headache, outweighs the need to educate our kids in person, period. Every night I come home from the hospital and I ask my kids how school was. Here's what they've said. I'm exhausted. I'm so bored. I'm just like you, Mom. I sit at a desk all day and don't move. I hate school. My two older kids said the worst part of the 2 weeks of virtual school was the daily interruption from teachers' own children during classes. The responses are, sorry guys, I didn't have anyone to watch my kids today. These are 3 kids who used to love school. Their social skills and aptitude are suffering. Their emotional health is challenged every day. It's these micro instances that are building and weighing down my kids and my family. How much more of this should we take? Why have you removed our choice? Open up the schools. Let's give our kids the education that they deserve. Thank you.
Thank you, Ms. Amy Myers. If you would unmute, please. Ms. Myers, if you could unmute. I did for a second. Try again.
Hello. Can you hear me now?
Yes, Ms. Myers?
Yes.
Yes. Go ahead,
Thank
please.
you.
You're welcome.
Thank you. I just want to congratulate the board, Dr. Yanni, the staff. I think you've handled this situation very well. I'm sorry, I'm supposed to say I'm from Drescher. I have children at Jarretttown. I just want to say that I feel like the communication from the district has been superb. I feel like I know what is going on and when it is happening. So I wanted to say thank you. I also wanted to say that I wanted to echo what Lisa Barry mentioned before me, that I'm sincerely hoping that when students come back into the building, that we have classes that have teachers that are teaching only students at home and only students in school. I ask this as a family that has chosen Cardinal Academy for the foreseeable future. We made this choice when everyone had a choice back in the beginning. And one of the things we liked about it was that our students wouldn't see other kids in class, in school, when they couldn't be. And so when you send this survey, I just wanted to encourage you to perhaps ask a question, which is, would it be interesting to your family to make sure that you're in a class full of students that are online only, with a teacher with them only? I just wanted to say thank you again for your time, and I hope that that you all have a wonderful night. Thank you.
Thank you, Ms. Myers. And next we have Ms. Kathleen McGettigan.
Hello, thank you very much. Kathleen McGettigan, I'm from Ambler. My issue is with non-public transportation. I have emailed Dr. Yanni, Ms. Franchik, and many government officials trying to get buses resumed. I'm a taxpayer along with all the other parents who send their children to non-public schools, and our busing is funded by the taxpayers, as Mr. Yanni said at the meeting last week. We want our money used for busing. That's a right for our children to get to school safely every day. And busing can be done safely. SEPTA does it daily. Our children, the difference between SEPTA and our yellow school bus is that our kids can be tracked. We know the names that the schools attend. We know what bus numbers they are on. We can track our students. I see buses sitting for 20 to 30 minutes waiting for their children to board to take them home. That's the perfect time for the buses to be sanitized, wiped down to prevent any type of virus. The Bus drivers can wear masks and face shields, and we have buses large enough for distancing on the bus. And the children can be held accountable for wearing their masks and behaving. Other districts we see with their buses in the schoolyard: Centennial, Philadelphia, Hatboro Horsham, Abington, Wissahickon, and our own township will not bus our children to school. That's an embarrassment. Springfield has reached out to our principal, and they are in negotiations for busing our students. I think our district needs to do the right thing for their taxpayers, for the safety of their students, and bus our children to school. Car line pickup is a traffic nightmare, and someone is going to get hurt. Thank you.
Thank you. Next, Ms. Jenna Evans, if you would unmute.
Hi, this is Jenna Evans. I live in Drescher. I have 2 children at Jarretttown and 1 at Sandy Run. And I'd like to weigh in on one of the topics Ms. Barry raised earlier. My daughter is in one of the 2 Jarretttown 4th grade classes that is referenced in the agenda, and for which the administration will be seeking your permission later tonight to exceed the board-approved maximum of 24 students. What you're really being asked for, though, is forgiveness instead of permission, because we're already 2 weeks into the school year, which means there's not much that can now be done. So my first point is that for everyone's future benefit, I would strongly suggest that these matters need to be brought to the board's attention before the school year starts, as it's frankly too late when the students have already begun the school year. On a more substantive level, I'm confused why in this year, of all years, we would place additional stress on our teachers and make it that much harder for students to get the attention they need. That being said, I do want to applaud these 2 teachers, because based on my own observations and those I've solicited from other parents, they're doing a fabulous job in making the best of an unfortunate situation. It really is unfortunate that we're in this situation, because it could have been resolved by adding a 4th teacher before the school year started. To be clear, this is not a new problem. This particular grade was pushed over the maximum in the fall of last year when a new student joined the school. So going into this school year, it was a known issue that this class had a class size issue. And indeed, the class appears to have grown by another student since last year. Lastly, from a fairness perspective, I'm frustrated that these 2 classes are now being prejudiced by having the highest class sizes among the 75 plus other elementary school classes across all 4 elementary schools. While these 2 classes at issue are admittedly only 1 student over the maximum, this means that they are likely several students over the more comfortable class sizes that many other classes are enjoying. So what am I asking for? To be clear, I am not advocating for adding a 4th teacher at this time and splitting the classes up at this point in the year in order to bring them under the 24 student maximum. And based on feedback I've received, I believe most, if not all, affected families feel the same way. This is already a difficult enough time to begin with, and I don't want to make this situation any worse by forcing students to change teachers. So I guess what I'm actually suggesting through gritted teeth is that you go ahead and vote yes, again, because the alternative is even more disruptive at this point, and so you've been left with no other choice. I can't speak for these teachers, but perhaps they would appreciate having an educational assistant assigned to the class, particularly if they're going to be expected to juggle both in-person and virtual students in the coming months, a separate issue for which I think every parent from every grade at every school could use some clarity. But above all else, I think proper planning needs to be put into place so that these kids don't have to endure a 3rd year of inflated class sizes again next year. And let's please address it before the start of the next school year, not after it's already too late. I certainly recognize that this has been an unprecedented year, and there were many, many difficult problems the administration has had to face, and that had to be prioritized above this issue. However, it is exactly that unprecedented nature of this school year that makes it that much more frustrating to me that we find ourselves in this position. That being said, I am extremely grateful for the Herculean efforts by the district this year, and I don't want anything I've said here to overshadow my gratitude for those efforts. Thank you.
Thank you. Next, we have Susan Torrison. You may unmute.
Yes, hello. I'm from Maple Glen, Ambler. Just a couple things you had mentioned, Dr. Yanni had mentioned earlier about surveying families. Why weren't the private school families ever surveyed and asking if we would feel the safety of our children would be jeopardized if busing continued? I really felt the heart of, I apologize for not remembering her last name, but the woman Pam, the hospital administrator. These kids need to be in school. And I'm so thankful for the school. We send them to Calvary Christian Academy and the other private schools who chose to open and follow the proper protocol and procedures to keep our children safe. And that being said, were you, as a board, aware that Upper Dublin, I'm sorry, I'm just upset about this, that Upper Dublin is the only district out of 14 in our school who chose not to bus our children. And at the last board meeting, you justified your decision for safety reasons. It's proven, it's been okay. With the proper policies, procedures, protocols, supervision in place, these kids will do the right thing. And there have been no reported bus cases, to my knowledge, at any of these private schools. And for you guys to just make that decision as a board is very disheartening to me as a parent without a survey or a choice. Yes, it was my choice to send my child to a private school, but it's not my choice to pay taxes and not get the service that we're deserved. There's legislation in place that may mandate you to do this, but I would hope that that aside, that you might feel it in your hearts to just do the right thing, as the other districts have. I'm just appealing to you guys to do the right thing. The safety, we're okay with our children being on buses. And obviously the other 13 or 14 districts, those bus drivers were not strong-armed to drive. So I don't see that this should be an issue moving forward. And yes, of course, I'm hoping your kindergartners go back October 4th, but if for some reason they don't, I still hope that you guys will do the right thing and bus our private school children.
Thank you. Tom Siriani, if you would unmute, please.
Hi, thank you. My name is Tom Siriani. I've been a Maple Glen resident for 18 years. I have 3 children in the Sandy Run Middle School. And thank you for this time to talk. And I want to start off by saying I commend you guys for taking the steps in the right direction to start with the kindergartners and special ed group. Although I do agree that it should be extended beyond kindergarten in the first rounds. But I appreciate the right direction. So look, I understand that 9 board members have a difficult job, and that's during a normal school year. And that's not to mention the dynamics of the current situation that we're in. With that being said, I want to express my extreme disappointment and frankly, anger at every member of the board. It clearly states in your policy manual that you are to, quote, act as a general agent of the people of the district in the matter of our education. The people of the district, not the 9 of you, you're supposed to act on behalf of us. The fact that the 9 of you felt that the community would be okay with you making a decision with virtual only and not following through with Dr. Yanni's plan to even survey the community is laughable that you think that was okay. You to act as an agent of the people. That means to be willing to listen and process what the community has to say. Frankly, the behavior appears as though you've intentionally avoided community input. I don't think anyone would disagree that the fact that virtual education is a must. We're in a pandemic. It's a dynamic that we must live with, and it must be an option. Option is the critical word. The 9 of you, without surveying the community, decided that you felt what was best for my family and for many other families. You avoided the option. And frankly, you got it wrong. People are struggling. We've heard tonight. Students are disconnected. We've heard that they hate school because you felt that you were in the right to make a decision for our entire community families. You must survey the community. And Dr. Yanni, I appreciate what you're saying that we've moved up the date to the 28th. That's not acceptable. It needs to be tomorrow. It should have been in August, and they should have listened to you, Dr. Yanni. It needs to be tomorrow. There's no need to wait a week. Surely not October. We need to be back in school. Surveying the community means to listen to the community. And yes, some kids must stay virtual. And there's others that must be brick and mortar. There are personal dynamics, educational dynamics, family and business dynamics that are probably beyond what you can comprehend for many individuals in the community. I'm begging you to go back to your policy manual and adhere to being an agent of the community and listen to the people. We must survey now and put action to place to get back in brick and mortar. Have the option available. Thank you for your time.
Thank you. Next, we have Joshua Carp.
Hi, my name is Dr. Joshua Carp. I'm an attending physician at about 12 to 15 hospitals. I want to make this clear to everyone listening. There's no solution to this just because we've put in our time and we're all getting tired of it. There's no solution until there's a vaccine. If you send a bunch of kids back to school and put them in rooms, especially the younger kids, they're not going to be able to social distance all the time. They're not going to be able to keep their masks on all the time. You have an opportunity right now to make one of two choices. And you want to make the choice where in 2 to 6 weeks, you're not having a press conference saying, we are sorry that a teacher got sick, a parent got sick, or God forbid a child died. I've watched people die from this disease. I understand that it's a small percentage that get very sick, but I will tell you that based on the current data, we do not know the long-term sequelae of this in every patient. So even a patient that's asymptomatic, we don't know if they're going to have long-lasting pulmonary cardiovascular effects down the road. So I'm not even sure why this is up for debate. I mean, you guys can make whatever decision you're going to make. We personally will be keeping our children home and doing, alternative schooling. But I think it's important for you to hear from not an administrator, but an actual attending physician that has been on these COVID units since day one. That's really all I have to say about that, but it is not the correct answer to reopen the schools right now.
Thank you. Next, Ashley Goldstein.
Hello, my name's Ashley Goldstein. I'm a new member to the district, moving to Drescher, and my son is a kindergartner at Thomas Fitzwater. I wanted to thank his teacher, Mrs. Melissa Joyce. She is amazing, and you can tell she's a true professional, and she is trying super hard. Unfortunately for kindergartners like mine and many others, it is just impossible to teach a newly 5-year-old young boy on the computer all day. It has turned my child into someone that hates school, cries, whines, throws tantrums, hides. He will do anything to not open that computer. If we don't go back to school soon, I will disenroll him because it is destroying our family. I have a 3.5-year-old who is basically neglected all day, watches TV, while I try to force my child to log onto the computer. I just beg you to reopen kindergarten for in-person and honestly expand that through first and second as well. I know that there's a lot of families that are struggling with children that cannot read yet, and that makes it really challenging because they cannot operate the computer on their own at all. It requires constant guidance all day. It makes it impossible for people to work, care for other children, other family members. It's not a fair ask. And on the heels of what the physician was saying, it's just about the choice. If people are comfortable, they should be given the choice. And if people are not comfortable, then they can do remote. But the fact that no choice was given and no survey was sent out is appalling. I'm moving from New Jersey, and every single district in my area sent numerous surveys. When I moved here, I was asking the community. I was told no survey had ever been sent, and I thought people were joking. Again, the board needs to act as the agent for the people, and the people are clearly saying, give us the choice. Thank you.
Thank you. Next, Jessica Furman. Ms. Furman, if you would unmute.
Hi, are you able to hear me?
Ms. Furman, we cannot hear you well, at least I cannot.
How about now?
No, I'm getting head shakes from the other attendees.
Or what to do about that?
One option would be to step out of the meeting, dial back in, and I will call on you next when you can come back into the room. Sometimes it's just a connection issue.
Okay, I can give that a try.
Thank you.
Sure.
Next, Irene Marzella. Oh, I think I've, hang on one second. I think I made a mistake. Irene, I hope I'm saying that correctly. If you can unmute.
I believe it's Ariane.
Oh, my apologies. Ariane? I do have you permitted to talk if you are able to unmute, Ariane. Wondering if we're having an issue with Zoom, Dr. Yanni. I don't know how we could possibly tell. I'm going to try to move on to the next speaker. And Ariane, if you can hear me, I would ask you to try to do the same as the last speaker, just to drop out of the Zoom and come back in, please. Kim Greenberg.
Hi, Amy. Hi, everyone. Kim Greenberg. I live in Drescher. I have emailed the board and Dr. Yanni various times. I mainly am just echoing what Pam Tufel put beautifully and Tom Sirianni, and numerous others. I mean, I honestly feel like it's laughable. We have not been given a choice. Nothing has been sent. Dr. Yanni said we can't compare to public or private. Totally agree, they're different. But as Pam said, numerous public schools around our area are opening. People are speeding up their openings. And I appreciate Dr. Carp's comments as a physician, and I respect his opinion. I have spoken to a lot of physicians, also friends of mine, who feel the opposite, more along the lines of what Dr. Yanni had said last week, that we need to learn to live with this. This isn't going anywhere, and you need to be smart and you need to be responsible, but you know, life goes on. So we need to move forward. We need choices. Not having a choice and not having a voice is probably the most frustrating situation I've ever been in. And the fact that 9 people are making such huge decisions for my family and all of the community, and it's mind-boggling. And I think one voted, you know, to have options, and the rest of you, I mean, Amy, you live up the street, like you have kids. You have to. Are they doing great? I don't know. I think one other person has school-age kids. Are your kids doing great? Like, how, you know, like, we need to get back. So it's very obvious to me, and I think to a lot of people, that you just need to be given a choice and options. And I love that you're sending kindergarten back, most likely, and special needs. That probably should have been done from day one, but I love that you're doing that now. I hope that you accelerate the process for the rest of the grades. My kids, one is supposed to be at Jarretttown, one's supposed to be at Sandy Run, and they're not doing great. And the teachers are absolutely wonderful. I commend all of them. I mean, they've made it as great as it could possibly be, but it's not the same. And you all know it's not the same. And there's better solutions, and you need to do better. It's ridiculous and shameful. So that's all I have to say.
Thank you. I'm going to move back now if anyone is just joining the call. Ms. Jessica Furman was trying to dial in. I'm going to go to her. We had a connection issue. Ms. Furman?
Hi, are you able to hear me now?
It's a bit better. Go ahead, and I need to ask her to clarify if I need to.
Okay, I appreciate that. So it sounds like a lot of people have things that have been beautifully written. I am going to speak from the heart. My name is Jessica Furman. I live in Ambler. My son was registered to attend Maple Glen Elementary for the first time, and he was so looking forward to it. He's been in attendance at a preschool since he was 10 months old, and he has always loved to learn. He's been a fabulous student, really intelligent, and he is a good boy. And the day I told him, you know, he can't go to Maple Glen Elementary was just heartbreaking for him. And like so many others have been saying, this virtual learning has been a disaster for him. He's not learning anything other than hating education. He's being taught to hate school because he is learning nothing. He's bored out of his mind. He doesn't want to be sitting in front of a computer. He's learning to hate technology. And his emotional distress is very difficult for us as parents to see, as well as his teachers at the center that he is attending, to help him, because we are a working class family. We don't have the option of sitting with him and helping him. So our paychecks are currently going to a center to help educate him virtually. I'm sure that many other families are in the same boat that we are in. But the reason I wanted to say my piece is because, like so many other families, I'm really disappointed with what the school district has chosen to do here. Quite frankly, I think you should be embarrassed by what happened. And judging on the decision that you make this evening, I think that it will be clear where your priorities stand. You have people begging you to make the right choice for their children. It's upsetting to me that I don't have the ability to make the choice for my child. I believe Ashley Goldstein said that she will be pulling her child from the school district if need be, if you don't make the right decision this time around, which is at least to give us the option. And I'd like to say that I will be doing the same thing. And I've been living in Upper Dublin since I'm 14 years old. I believe in this district. And for the first time in my life, I am having serious doubts to the point that I am honestly considering putting my house up for sale and moving to Wissahickon School District. You've mentioned that we might go to half-day kindergarten. That's not what I'm paying my taxes for. I've been told that we get full-day kindergarten here. I want full-day kindergarten. In response to Dr. Carp's statement, you know, we put our kids in the car every day, and that's dangerous enough. So again, you know, I'm not going to harp on that. We're all taking risks with our kids, with our families, and that's our choice to make. And here we are just asking for an option. We just want options. The other thing is, you've had more than enough time as a school district and as a board to plan for this scenario. Enough is enough. Make the decision. Let's move forward. No more excuses. We're down to the wire here. We want the kids back in school. Let's do this. You have your busing program. You have all the necessary requirements for the healthcare, yada, yada. So please hear us out, make the right choice, and let's move forward. Thank you.
Thank you. Jolene Wilson.
Hi, it's actually Jolene's husband, Nick Wilson. I just realized I'm logged into her account, so I apologize for that.
And just let us know where you're from, Mr. Wilson.
Yeah, I'm from Ambler. My two children go to Fort Washington Elementary School, a kindergarten and a third grader. I want to speak particularly to my kindergartner. It's clear that this is not effective. Her teacher, Miss Young, is phenomenal. She's doing everything that she can do. That's very clear. However, our daughter just doesn't act the same. You can tell she hates school. She never hated any type of education, pre-K, anything like that. And now she does not want to be part of it. She begs not to sit in front of this computer anymore, and she wants to go to school. So that's my first point. My second point was just made. I think that kindergarten should go back and should go back full time. I don't see why a half day is any more safe than a full day. So I think kindergarten needs to go back full time. I think all the kids need to go back full time, but particularly kindergarten. And then my final point, I heard from a board member that, you know, that particular person voted against it because the plan didn't provide enough safety provisions in it. Well, I say it's time to work together. Let's figure that out then. If there's not the safety provisions that you need, work with the administration, figure it out, and send these kids back to school. Because it sounds to me like the majority of the people on the phone are much more afraid of the social impacts of not sending these kids to school than they are of the risk of going to school, especially if proper social distancing is going on. Thank you. That's it.
Thank you. Next, Margaret Shimko.
Hi, can you hear me?
Yes. Yes.
Hello to the board and Dr. Yanni. My name is Margaret Shimko. I am from Drescher. I know some of you personally, and as you may recall, I wrote 2 letters prior to the beginning of online school imploring you to reconsider your decision to remove the choice to allow children to attend school in person. Clearly, my letters fell on deaf ears. I have 2 children. My son is in the beginning of his freshman year. He is what is called twice exceptional, autistic, and gifted. He holds both an IEP and a GIEP. I'm wondering how the district plans to honor both of those legally binding documents and their justification for delaying their legal obligations. He and others do not fall under the category of those special needs kids who will return in October, and I know that my son's needs, and I know others like him, are not being met virtually. You put an autistic kid in a chair in front of a computer for 2-hour period classes. As I've requested before, I would like the board to disclose which medical professionals they are currently using and have been using to guide them, but that our community can be assured that they are making an informed decision. And I have a little comment for Dr. Carp, who called in. I'm a nurse. I've been working the entire time, hands-on, touching patients throughout this entire pandemic with just a mask and goggles, that's it, and Purell. We are able to do it safely. And he and his comments are going against the recommendations of the American Association of Pediatrics and Dr. Fauci and many, many, many other medical professionals. I would like to add one more point, as I mentioned in my letters. You are leaving the children of Upper Dublin emotionally and educationally disadvantaged. Schools throughout the county are returning. The board's decision has damaged both of my children, and I'm infuriated at the way this was handled. Thank you.
Thank you. I believe next, Jim Owens.
Good evening. This is Jim Owens. Can you hear me?
Yes.
My name is Jim Owens. Like I said, I'm from Drescher. So I just have 2 points that I just wanted to make. The first point is that we all basically have known about this. We've all had months to come across and get a plan together. And I'm just disappointed in the speed of returning our students to the classroom. It's frustrating that a district the size of Central Bucks can swiftly move and do its best for their students so quickly. I know we don't like to talk about the public and the private schools, but a group of nuns right down the street came up with a plan this summer to get their kids back in safely. My second point is about the communication or lack thereof from this board. Dr. Yanni is very much well-liked by the parents of this district. He respects our input. He regularly communicates with us. The parents are the ones that you, the school board, represent. We're the ones that are volunteering for the PTA. We're organizing fundraisers for band, for football. We're participating on various steering committees. We're just as involved. And yet, you stripped our voice. I would suggest that the 9 of you take a page out of Dr. Yanni's very successful playbook. Do a better job communicating to me and the other parents so that we can work smarter together. And that finally brings me to the school board member who chose to berate a fellow parent this month. His behavior was inappropriate. And I think it's time that he consider maybe that public service isn't what is in his cards, because he doesn't act like a gentleman. And what he doesn't seem to understand is that these moms, and might I add dads, in this district aren't going anywhere. So he better learn to work with us or get out of the way. Again, we can do better as a district. Thank you.
Thank you. Jackie Spinoza?
Hello, can you hear me?
Yes.
Hi, thanks for having us on tonight. I have two children in Fort Washington Elementary, 3rd and 4th grade. We're in Ambler. I can't even begin to thank the teachers, the principal, the administration at Fort Washington Elementary. They've been nothing but phenomenal for the past 3 weeks. We actually had our children in Catholic school, and 2 years ago we pulled them out because of the phenomenal reputation that Fort Washington Elementary has. I'm not saying that I'm going to remove my children, but since July we have been utterly disappointed in the direction that things are going. The fact that we are taxpayers and we chose to send our kids to Fort Washington and we don't have a say is so disappointing and gut-wrenching. So that's my first point. My second point is my kids that go to Fort Washington, they're both boys, totally different personalities. One cannot sit still all day. That is not who he is. He cannot sit in front of a computer screen. His attention span will not last, and it's devastating to watch him not be able to focus and follow the commands of his teacher, who's trying effortlessly to get him to focus. My other son, who's in 4th grade, is shutting down every other day. We're trying to get him to stay focused, but he's so frustrated with the learning, this way of learning, that it's not working for him. So all I'm saying is, please listen to the parents on this call today and take into consideration how our kids are being affected at this point, and it's only week 3. So I don't know, that's all I have to say. I think about my children all day long and how devastated they've become being remote. So just please listen to what we're saying. Thank you.
Sorry, my apologies. I was muted. Keith Herzog?
No, thank you for giving me a chance. I'm a physician, and I just wanted to speak a little bit to what the previous physician had spoken about. I have to defer experientially to him in terms of his experience with patients. I've been out on medical leave for quite a while and haven't had patient contact, but I can say that I followed the literature in pediatrics, and certainly the frequency of illness, the degree of illness, and the consequences and even transmission is clearly much lower than in the general population or the older population. But I think that, as you're hearing from the parents, and we feel the same way, I think very strongly feel the collateral damage of the shutdown and not going to school is much greater than the impact of COVID. I think this is a huge negative impact on children in terms of their psychological well-being, in terms of family discord, family dysfunction, abuse, domestic violence, depression, anxiety, substance abuse. It's just very clear that this has had a huge negative effect in terms of other aspects of patients' lives. That's not to mention that the financial impact it has on parents. And you hear it in everybody's voices that this is just very, very trying, and really is not manageable for the next 9 months. This really has to change. So I think from a pediatrician standpoint, we're all very willing to take the small, but significant but small risk medically to address these psychosocial issues that are just huge.
Is that all of your comments, or did we lose you, sir?
No, that was pretty much it. I also want to mention the busing that we are attending Calvary, which has been a wonderful experience. The kids have been there for 3 weeks. I'm not aware of a single case of COVID there, and they're loving it. They absolutely love it. And but we also need busing there, so that was our issue initially.
Thank you. Richard Friedenheim?
Good evening. Can you hear me okay?
Yes.
This is not prepared. This is just off the cuff. So first of all, As a parent of 2 children at Fort Washington Elementary School, I'm just disappointed in a lot of the communication that's occurred. I've conveyed this in written fashion. There have been many excuses for why things are being done in the timing in which they are. I've heard that there are not enough teachers, and the question is how many of the teachers are taking off because they have their own childcare issues. My experience, I have kids who are doing dance and tennis and other things. So by virtue of them not being in school, doesn't mean they're not getting out. They're wearing their masks. They're 6 and 9. And it's just, there's a lot of activities and a lot of groups that are still congregating. It's not like everyone is and no one is doing anything. We have a full-time group of administrators who are outstanding. They are full-time. Dr. Yanni's done a great job by deferring to his expertise rather than people who, in some cases, are taking the school board position seriously and others are looking at as trophies on their counter, whereby 3 of the 9 school board members currently have, if I'm correct, students who are actively enrolled in school, 3 out of 9. I'm not sure why we're not deferring a little bit more to Dr. Yanni, his expertise. This is difficult. It's dynamic. Things could change. We could be in school and 5 days later, things can change. So I really think there's a lot of choices to be made. I think that we're underestimating the elementary schools in particular. I think the elementary schools versus the middle schools versus the high schools are a little different. You're seeing that based on the fact that you have college students who it's a total mess. The little kids are pretty trainable, and I think we should be moving things up a lot quicker. So as a parent, I think it's a difficult situation. I think we should be moving to go to school quicker. I think I appreciate Mr. Owens's comments about everything he said. It made me smile. I almost started clapping, including those comments about certain school board members who have been incredibly demeaning and nasty, and in some cases don't even know that all the schools have air conditioning. But I think the main point here is that it's about the kids and the families that are suffering. As you said, the special needs kids, it's horrible. And I think that we have a terrific group of full-time employees who are doing a great job, yet we're not deferring totally to them, and we're relying on people who may have their own personal agendas. Finally, I'd just like to say, I am a pulmonary critical care physician. I'm board certified in pulmonary and critical care. I'm not a pediatrician. I'm not an educator. I really am not. I'm learning what we do in the hospitals. I'm learning every day. What we did 5 years ago, 1 month ago is changing. And I think we have to look at this as a similar process, that it is not black and white, it's very gray, and that the decisions we make today with the information we have today may change. But at the same token, I don't think that we should be ruling all the possibilities out, whereby families can have a decision that they make. If they want to be at home and do virtual, fine. If they want to come in, fine. Don't underestimate elementary and middle school and possibly high school's ability to be vigilant, to take this seriously, and to provide the kids with the optimal experience that they and their families come up with, rather than them being told how they should be managing their affairs. Thank you.
Thank you. Jennifer Rulon.
Yep, that's me. I'm actually not speaking on behalf of myself. I'm speaking on behalf of my autistic daughter who's in 9th grade, who is nonverbal, has apraxia, and has to do virtual. Now, I too am a special needs teacher, and I have come home from Abington, where I work half days with kids with special needs. And I come home and my husband is home with her, and I am doing speech. She's doing speech online. She speaks with an iPad. Now, I cannot for the life of me don't understand. And I have had several discussions with the leadership committee about what happens if this doesn't work. And that was back in August. And they said, well, it could get better. Well, guess what? It's not getting better. She's frustrated. She has very complex needs. And I feel like she has no voice, none, because it's been taken away. Because this will be perfect for her. It's not perfect for her. You knew it wasn't perfect for her. You knew the kids with special needs needed to be in. They needed to get their services. And in fact, her services are required by law. So since I didn't get her services 6 months ago when we had COVID, now we've done them almost basically the month of September, and the same thing is happening. How am I supposed to recoup that time? I mean, is there a value on that time? I mean, besides anxiety, all that other stuff, is there a monetary value? I mean, that's what I don't understand. Like, I understand it's a big township, and I understand not everything works for everybody. But for her, I guess I'm just frustrated because other townships have thought about this, have brought their kids in. They're getting the services required by law. And still here at Upper Dublin, oh, by the way, I've lived here basically all my life. That Upper Dublin still waiting until October 4th to get kids in school. I just don't understand the rationale. I understand metrics. I get all that. But it's very disappointing. I graduated from the school. My family's graduated from the school. And it's been very disappointing. We went from a blue ribbon school district back in the 80s and 90s to, not quite sure what's going on. But I've moved back here because I love the district, and it's really been making me wonder why I came back. Thank you.
Thank you. Emmett McGowan. Mr. McGowan, if you are able to unmute. Mr. McGowan, I'm unable to hear you. If you are trying to unmute, I'm going to put you back. Oh, wait, I think you've got it. Go ahead. I still cannot hear you, Mr. McGowan. If you would kindly disconnect and dial back in, I'm going to move on, but I will come back to you when you come back in. Julia Watt.
Good evening. This is Julia Watt. You can hear me, Amy?
Yes.
Thank you. Thanks everyone for taking the time. I just want to reiterate the appreciation for everything everyone is doing. Dr. Yanni, the administrators, all the teachers and staff, honestly just going above and beyond. I'm in Fort Washington. I have a first grader at Fort Washington, 6th and 8th grade at Sandy Run. Have been in the district for 8 years. I am on both sides of the Zoom Google Meet calls, as I am a school-based speech language pathologist, virtually delivering services, as well as a parent to the 3 children in Upper Dublin. A few points and questions regarding the survey. Many districts have been given, parents have filled out surveys multiple times over the past few months, past few weeks. I'm still perplexed as to why the board decided to shut down and virtually teach children 100% without any parent input. Why are we waiting still even until next week to get that survey? Another point I'd like to make is the virtual learning Cardinal Academy. While again, teachers are going above and beyond, trying to creatively think outside the box. It is just so much screen time on all of my kids, all of these kids in Upper Dublin. It's, again, that psychosocial mental health issue that is just so important. You know, my first grader thought he hit the jackpot when he heard he got to go pick up his Chromebook. It's just so much screen time, and it's just really unfortunate that the kids are just, you know, being in front of the screen so long with very limited expressive communication, language processing skills. So much of it is just receptive, watching and, you know, hunting and pecking on the screen. And I've asked for years, you know, why our kids have not been taught how to type. Now kids are being required, 85, 90% of their work is submitted online, and my kids are still hunting and pecking and clicking where they're not able to type. I wanted to ask a question about the air quality in the trailers. I know Dr. Yanni had a lot of great information about the air quality and tested, but I wanted to see about the trailers and in the old Sandy Run building. I also, as a couple of the few first speakers asked, if we are in person, I ask that it be in person and not be virtual, not push all the first in math and the reading eggs, but, can we make sure that they are using paper and pencil and books, and not being on the computer. And just if we were to look at that, can we just properly vet a hybrid model, with using the academics without so much screen time in the school building. And then just, when the board is making decisions, I just ask that you do your due diligence, to vote for all students virtually in the summer was a disservice. As a speech language pathologist, I've worked with so many low incidence students who have such great special needs. And it truly is a disservice to not consider them to be in person at the start of the school year. And lastly, I just, again, I thank Dr. Yanni, and I do thank everyone for what they're doing during this time. I do ask if and when a parent does reach out, takes the time to send you an email that, professionally and just, to be able to acknowledge that you received that email would be greatly appreciated as a parent in this district. Thank you.
Thank you. Mr. McGowan, I'm going to try again. Is it working? I see you're unmuted, so we should be able to hear you. If you have a headset or headphones on, if you would attempt to disconnect that or to actually use headphones perhaps. Yes, we've got you now.
You hear me?
Yes, I do.
Oh, how lovely. Okay. So, hello, Emmett McGowan. We live in Fort Washington. Our children attend Jarretttown. And I think this is quite comical. So I'm a lawyer, and I am on Zoom meetings and all these conference calls. And you can see how good I am with the technology. So you can imagine how my special needs daughter is able to, get through a day of school. I'm here to voice our concerns. The teachers have been great. The administration has been great. This setup is a disaster. So my daughter is a special needs first grader who has an IEP, gets multiple services, and she's supposed to get her physical therapy virtually. It's just not working. I understand there's a vote tonight for the special needs kids, and I appreciate the expedition of that portion of the student body. But I also have a neurotypical third grader who is doing well at a pod, but financially it is effectively $1,000 a month on top of our property taxes for our child to go to public school. I'm actually having a quite difficult time hearing myself through the thing, so I'm going to cut myself off. But again, I want the kids back to school ASAP, and I hope that the board does everything within their power to make that happen. Thank you.
Oh, my apologies, I was muted. Jim Burns, if you would unmute. Oh, Mr. Burns, I'm going to try again. I'm pressing the button. There we
Hello?
go. Yes.
Can you hear me?
Yes, we can.
Well, thank you. My name is Jim Burns. I live in Fort Washington. I have twin sons that are at Sandy Run Middle School, or supposed to be. Like everyone else, I just want to thank Dr. Yanni. I want to thank the teachers and everyone that's put such a tremendous effort into this difficult time that we're all in. I'm calling in as a dad. I've had the unique perspective of being a dad and watching this since March. And 2 points I want to make, because so many people have made so many wonderful points here this evening. I don't want to try not to be repetitive. I really want to speak directly to the board. And number one, choice. You have to give choice to the community. Choice to make decisions that I, as a father, feel are best for my twin sons. If everyone has that choice, they will make that important decision on behalf of their kids. This way, if Dr. Carp feels his kids are going to get coronavirus by leaving the house, he could keep them home. If I feel that my kids could follow the protocols and go to school and have the experience they deserve, they can go to school. You have to give choice, and you have to give it with a sense of urgency. It feels like we've been in this wait and see mode, and all I've waited and saw was all these other districts get back into school. So please give us the choices necessary to make the decisions for our children. Trust me, I know what's best for my twin boys, better than you. Secondly, you have an opportunity this evening, as I understand it, to allow the all-important special needs children and the youngest of our community get back into school by, I believe, the 4th or 5th of October. You are our advocates in this thing and are supposed to be. When you accepted your board positions, you took on the responsibility to be leaders in this community, to be public servants. Please give hope. That's what everybody on this call wants. They want hope. They want to see that we're moving in a direction to get back to normalcy. Normalcy is not virtual learning. Normalcy is getting up every morning, brushing your teeth, making your bed, hopping on a bus, and going to school. And everybody in this community right now needs hope. You have a chance to be that light at the end of the tunnel and start to move us in that direction. I implore you to take that seriously, to listen to all the wonderful comments that have been made this evening, and to give us choice, and please give us hope that you're going to be part of the solution in getting us back into schools. Thank you very much for your time.
Thank you. Seeing no additional hands raised, I will close community input, the first session, at this time. And I will move on to the opportunity to respond. I'll first start with Dr. Yanni. If you have any comments.
Mrs.
Yes.
Franczek, I believe
Yes.
there are hands up still. There, Ms. Olivieros.
We also have a few written comments, Mrs. Franczek.
Yes, we typically take those at the second public comment, because we don't know exactly if they've touched on a topic. If Mr. Diazio, if you feel like they are on topics that were covered in previous items, we can take the written. I do not see, I am looking at the attendee side, and I do not see any hands raised. Oh, you know what, I do see one, but it's not Oliveira. That is not what I'm seeing. So if someone has a name for me, I only have, I apologize, I'll reopen community input for Chris Tufel.
Yes, and I also see, I see Chris Tufel and Olivieros.
Okay, that is not raised on my screen. I'll try to refresh while Mr. Tufel is speaking.
Hi, can you hear me?
Yes, apologies for the confusion.
No problem. Hi, folks. Chris Tufel, live in Drescher. You heard earlier from my wife. We have kids at every level in the Upper Dublin School District. My comments are relevant because they apply to all of the agenda items tonight. I'm speaking tonight in reaction to the previous board meeting where it was decided to delay the blueprint for resuming in-person instruction put forth by Dr. Yanni, and I'm speaking to proactively prevent similar disappointments. I like to lay my bias bare, and it's true that I wish for a different outcome, but my great disappointment was and remains the lack of effort put forth by all board members to scientifically or factually support the positions they took. To a person, I heard how each of you felt. Your feelings are important and valid. They should guide many aspects of your lives. I just don't want them guiding mine. More so, I don't want your feelings determining the importance of my kids' social, emotional growth and development. Because you were, in your own words, and I want to read, afraid, concerned, worried, incredulous, and uncertain, you made the call to delay in-person learning. Let me be clear, it's hurting my kids. There are 7 houses on my Aiden-Lair cul-de-sac. Among those 7 families, there are more graduate degrees than there are in most of the school districts for which I've worked. It's nearly as impressive as all the Upper Dublin board members whose titles are doctor. Our community is almost an embarrassment of intellectual wealth, which is why it's an even bigger embarrassment that we ignore science when we make the biggest decisions affecting our kids' lives. I said your feelings are valid. I believe this is true because I think you had access to the great American institution of in-person schooling, and your emotions probably developed in a healthy way. Congratulations. I want the same for my kids. Step up. Use your impressive intellect to appeal to ours. Tonight, you might say that you don't feel like the needs of kindergartners and special needs students matter enough to send them back to school. I know you might say that because you already have. I can't believe it, but you told kindergartners and special needs kids that they don't matter enough to warrant in-person education. I just can't believe you did that. But if you say it again, please don't embarrass yourselves again by failing to intellectually support your position. In closing, maybe you find my assessment of the UD community to be intellectually elitist. So let me appeal to you in terms that might make you feel more comfortable. In the words of someone known to all Philadelphians, Apollo Creed, be a thinker, not a stinker. Thank you.
Thank you. I do not see another hand raised. Ms. Evans, do you see one? Or Dr. Yanni?
I do not see another one.
All right, very good. So we will close community. Oh, I'm sorry. Mr. Diazio, to your point earlier, I think since we're already in the mode of doing our community input, we might as well bring in the written comments. I typically save them for the end, but we might as well go ahead. I believe that they are related to agenda items this evening.
There are 4 comments that were received. I believe 2 of them are relevant to items that the board will be taking action on, and then 2 that are more appropriate for the second comment period.
Thank you.
So I'll go ahead and I'll read the 2 on agenda items. So the first one is from Sharon Herring from Fort Washington. And the comment reads, why are decisions regarding elementary students returning to school lumped together with middle and high school students? Elementary students and teachers face significantly less exposure risk by being able to stay in one classroom with one group of students all day. Please explain the rationale for this decision-making strategy. And number 2, why hasn't the board convened a committee of parents who are physicians, teachers, and public health experts to inform and advocate for the district's return to school plans? There are many of us with children in the district who have medical and educational expertise, and we would love to help in the decision-making process. We could be strong advocates for the messages you are communicating. Please consider using parent experts to back you and help you make decisions. These are the same parents who will support and advocate to elect you in the future. And the second public comment comes from Heather Culp from Drescher. And the comment reads, you may or may not discuss or confirm tonight, but why stop at just kindergarten? I'd say that all children, at least through 2nd or 3rd grade and younger, are not independent and need more attention that available to home and that available at home, as well as learning foundations for math and reading at these grades. When doing metrics, will you be stratifying by age? Given the low rates in Montgomery County and all being in the older population, these numbers shouldn't affect our kids returning. Thanks. So those are the 2 comments, and then there will be 2 more for the second comment period.
Thank you, Mr. Diazio. So now I will close community input. I do see that, okay, I guess I can bounce back. I see another hand is up. Tina Poland.
Hi. I wanted to put in that Central Bucks is going back to school. All elementary kids are going to be 5 days a week. Secondary kids are hybrid. Quakertown kids are back to school hybrid. Palisades kids are back to school. Penridge kids are back to school. Palisades and Penridge follows the modified quarantine. Penridge, those kids just got done the modified quarantine. Everybody's okay. There's many kids in Bucks County that go to private school that their school is open 5 days a week for kids. They are all following the modified quarantine. It all seems to work. Your public health official knows Dr. Dansker. She could easily adopt the modified quarantine, and there's really no reason for her not to take advice from him and for your district not to take advice. That's it.
Thank you. Erin Stein.
Hi, can you hear me?
Yes.
Hi. I just wanted to make a comment tonight. I am so proud of our community that has come forward and expressed how they feel, what they're going through. This is a highly emotional time for everyone, and I feel like it is very clear tonight in all the different calls and speeches we are hearing from our community members. I 100% agree that our special needs and kindergarten students are at the foremost. They are most important that need to get back. But I do not want in any way for anyone to think that any student of any age is okay right now, because they are not. I have a 10-year-old, a 12-year-old, and a 16-year-old in my house, and they are not okay. And I don't want for any minute for anyone to think that any student is okay, because they are not. I will say that I have a student who has graduated from Upper Dublin, and he is now in college, and he is thriving. So I know what Upper Dublin is capable of doing. And I'm so proud of him, and I'm so proud of everything that the teachers and the staff and the administration has done for him. And I just want to see that for all of the children in our district, because I know what we are capable of. And right now, it is not our best time. We are not doing the best we can do right now. And I just want to make that clear, that everyone in this district is suffering, no matter if you are a teacher, a student, a parent. Everyone is suffering, and we need to make the changes now. We need to get the survey out now. We do not have time. These kids will not get this time back. They do not get these years back. They do not get any of this time, crucial time back. My 16-year-old said to me the other night, "Mom, I'm afraid I'm going to go to college and I'm not going to know what to do because I won't get the chance to even go back to school again." That is what these students are thinking right now. It is affecting them on every level. My kids cry. They don't know what to do. They don't know what's wrong with them. And this is not the way to live. We cannot go on one more day than we need to with this virtual schooling. It is not working. And I do think it's loud and clear, but I just want you to all know it's not just the kindergarten or just the younger kids. It's everybody in this district. Thank you.
Thank you. Lisa Burns. You may unmute.
Can you hear me, Amy?
Yes, I can.
I have zero. Oh, I have no time?
You'll have 4 minutes.
All right, sorry. I just wanted to say I appreciate, Lisa Burns from Fort Washington. And I wanted to say I appreciate the time that the school board has given us to come out and speak tonight. I too agree with Erin and want to say how proud I am of the Upper Dublin community and of the number of parents, moms, and dads that got up today and spoke from the bottom of their hearts. I've spoken to a lot of people outside of these calls, and it's hard for people, but people dug deep and they got really raw and honest on this call. And I just want you all to know how much we appreciate that. So with that, there's been a lot of questions and there's been a lot of comments. I'm asking the board, what happens now? How do we get those comments and questions answered so we feel like we're moving in a direction together? I don't know if it happens on this call or if it happens in a follow-up email, but that's something that I think everybody will want to know what happens next. Thank you.
Thank you. Okay. Seeing no more hands, I am going to officially close this community input. There is another opportunity at the end of the evening, and I would just ask that anyone else who has any future comments to please hold those to the second community input. I have indeed, I believe, covered all of the first session. Yes, and so I had initially planned to turn it over to Dr. Yanni for any feedback.
Thank you, Mrs. Franczyk. First, let me clear up a couple of small items before I respond to a number of some of the bigger items. So there's nothing nefarious going on with the class sizes at Jarretttown. There are a number of students on that grade level that will be attending some of our alternative or special education programming in the building. And so actual class sizes when we return will be at or below the class size guidelines. There seems to be some misinformation circulating in the community that there will be a time when we're back in school and teachers will have to teach kids in front of them and also teach kids virtually at the same time. That will not be the case, with the exception of potentially some courses at the high school that are singletons. And what I mean by that is courses that only run one time in a schedule. So I'll give you an example. We offer Latin and we offer one Latin 3 class. There may be a situation where we don't have enough kids to run a virtual Latin 3 class and an in-person Latin 3 class. And so there may be an instance like that where we have to have a teacher, providing instruction to kids in front of him and also kids that are virtual. But those situations will be very limited. And again, I'm giving the Latin example as just an example. It's not something that's a foregone conclusion. If that is the case, students and families will be notified about that. To the community members that spoke about non-public transportation, we will have to agree to disagree that the communications that were sent fell on deaf ears. I responded to all of those, and as we've said, when we resume transportation on October 5th for our public students, we will also resume transportation for our non-public students as well. I think there is a belief that the superintendent works in isolation, and in isolation from other administrators and in isolation from the board. I want to remind everybody that on July 30th, the board, the administration, and our Teachers Association released a joint statement about embracing the virtual path forward for instruction for the first marking period. The decision to have the first marking period be virtual was not something that was made lightly. And yes, there are some districts in Bucks County that are going back. If you looked on Central Bucks's website, they hired 30 long-term subs to be able to bring students back. We've been compared to Wissahickon. They hired 10 teachers. Decisions made are not made superintendent versus board versus leadership team versus community. So I want everyone to realize that our leadership team and our board are working collaboratively towards common goals, and that common goal is to be able to provide the option for in-person instruction. The first step in that is kindergarten, to bring kindergarten back and to bring our special education students back. As I said at the town hall meeting, just because we've put the date of November 9th doesn't mean that that date is hard and fast. That date could be accelerated. That date, if the state moves us from a moderate transmission county to a significant transmission county, that date could be delayed. However, we are listening to the community. You've asked for a survey. We're surveying our kindergarten parents and families tomorrow, making sure we get that data correct. We'll be surveying the rest of our families next week. And again, the November 9th date is not a hard and fast date. At the beginning of my superintendent's report, I spoke about the blueprint for in-person instruction being a living document. So we can be nimble and we can be flexible. Tonight, a number of folks spoke about the Colonial School District. I've been in communication with their superintendent, and without divulging too much information, it looks like our tentative return to school and their return to school is about within a week of one another. I do want to thank those folks that spoke kindly about our teachers tonight. I think our teachers have done a nice job of helping kids adjust to virtual learning. I also want to thank actually our entire staff, because it's not just our teachers, but it's our entire staff that's working together to make sure that kids are getting quality experiences. I want to say to special education families or families with special education students, if you have not reached out to your case manager, if you have concerns, please reach out to your case manager or one of our supervisors of special education, as well as our director of student services, to talk through those things. Again, I want to let everyone know that we are working together towards common goals. I don't want anyone to think that that there's anything nefarious going on. I think the Touch Base Tuesday communications that have been coming out, that will continue to come out, will continue to provide information. And again, that November 9th date could absolutely be accelerated if conditions exist to help us do that. One of the things that we were really clear about in the town hall meeting is there are some recommendations from the CDC and from the local health department that we can absolutely guarantee. So we can follow masking orders. We can, in some of our buildings, we can have the best grade, the best quality air filtration systems. But there are a number of things that we can't guarantee. And we're not making excuses, but there are some things we can't guarantee. We can't guarantee at all times kids are going to be 6 feet apart. We can't guarantee that no one is going to get COVID from being in our buildings. But what I can guarantee you is we're going to work and do everything we can to get kids back in school. And I'm thankful for the compliments tonight. I truly am. You have to know that we're working, and we're working as hard as we can to get kids back in school. I understand that many people have spoken tonight about their kids struggling with virtual learning. And I don't want you to hear my monotone voice and misconstrue that as pandering to anyone or not taking to heart what you're saying. These are the types of things that keep me up at night. I end every single video that I do, every Steve says with the same comment that your kids are my kids. We're working hard to make sure we get kids back in school, and we're all working towards that common goal. Again, I want to stress that we are not going to be asking teachers to try to teach virtually and have kids in person at the same time. But I do want to let everyone know, when kids are back, it's not going to look or feel like school looked or felt before. So there's going to be a lot more independent work. There's going to be less close-knit group work. We're going to be spreading kids out across satellite locations for lunches. Recess is going to look different because we have to do everything we can to keep kids separated. Also, I think some people have gotten, some people have said that I'm against a hybrid scenario. And it's not that I'm against a hybrid scenario, but I want everyone to listen to what a true hybrid scenario is. Last year, the Pennsylvania Department of Education gave us the opportunity to say we did not have to meet the 180-day and 990 hours of instruction. That same flexibility does not exist this year. And so in a hybrid situation, for the day to count, when kids are not in front of us, they have to have work that advances the curriculum, which means they're going to be learning without the benefit of a teacher, without teacher interaction. So if you think about, let's take math, for example, a student in algebra. In a given week, they're going to be responsible for 5 lessons of algebra, and they're only going to be with a teacher for 2 or maybe 3 of those days, which means there's a lot of time that they're not going to be with a teacher. That doesn't mean we shouldn't do a hybrid. That means if we get to the point of having to do a hybrid, we have to go in with eyes wide open. Because one of the things that I don't want to do is to create a situation where people are upset or not satisfied with the quality of work that they think they should be getting when kids are back in school. Again, November 9th is the date on paper. We can be nimble and we can be agile with that. Looking through the remainder of the comments.
Steve, the only other item,
Screen time.
sorry, go ahead.
No, I was going to say screen time. Screen time is something that we absolutely need to be mindful of, and it's something that we're going to need to be mindful of when we return to school as well, because the idea of blended learning is that kids will still have some technology time once they return to school. It won't be as if the computers go away when kids come back to school. So we're going to have to be very careful to watch screen time, not only while we're in virtual, but also when we're back in school. And I think, Mrs. Francis, did I get everything?
I think so, yes. We can always circle back if another board member sees something that was a repeated item. Thank you, Dr. Yanni. I'd like to address a few items. First and foremost, I'd like to echo Dr. Yanni's sentiments. I suppose, only seeing is believing, but in the last few months that I have served as board president, I can assure you that Dr. Yanni and I spend an inordinate amount of time in communication with each other, in communication with the remainder of the board. He is in meeting upon meeting every day of the week and has very effectively shared the communication and information that he's receiving from the State Department of Education, the State Department of Health, Montgomery County Department of Health, and Montgomery County Department of Education, or rather Montgomery County's commissioners, the various superintendent groups that he belongs to, and so forth. And I understand this is a high tension time. There's a lot of frustration, a lot of anger, a lot of concern in the community. All I can do is reassure you that day and night we are working together. Additionally, there were some questions regarding the number of board members who have children in the district. 5 of the 9 of us have students currently in the district, and most of the remainder had students that went through the district as well. I think what's challenging about this role, and folks asked about my personal situation, I try really hard not to bring my personal situation into the decision-making process. We work very hard as a board to base our decision-making on the information that we are provided. And as many of you know, the information about COVID has been imperfect. Additionally, when we initially made our decision in July, I have previously on past meetings taken responsibility for perhaps the awkwardness of the way the vote was conducted, because frankly, there was no playbook for how to handle something like this. And I can see how it may have appeared that the vote contradicted the plan that Dr. Yanni had set forward. All we were really attempting to do was put on the pause button, because we were told at the county level that there was no good turnaround time in testing and that contact tracing was problematic. And until those things were in place, which they have much improved since then, we really felt that things were in a concerning level. Dr. Rubin from CHOP, who advises the superintendents, was very concerned about the Labor Day bump. There have been a number of things that they've actually, Dr. Rubin has published, Washington Post and the Inquirer, about his concerns and about how where we are today is not where we were on July 27th. So I think, as you can see, we are working very hard to be flexible, to adjust, to listen. And on that note, I have tried my very, very best to answer every email that has come to me. I'm not perfect by any stretch. I'm a full-time working parent, 2 children, a husband, and in graduate school and doing this role. I'm absolutely doing my best. If I have missed anyone, it was not any effort on my, not lacking the effort on my part, and I do apologize for that. I think those were the specific issues that I wanted to address, and happy to take any comments from any other board members. Okay. Seeing none at this time, unless, I'm hoping my computer is not slow. Yeah.
I'm getting some confusion. So the Cardinal Academy is going to be an option all year long. We're not taking away that option. So the Cardinal Academy will be an option. When we bring kids back and provide the option for in-person instruction, the Cardinal Academy will not go away. And I think, you know, to remind everyone what I said several meetings ago, the Cardinal Academy will exist in perpetuity, because the Cardinal Academy is going to serve multiple purposes over the next couple of years. So the Cardinal Academy is not going away.
Great, thank you. All right, thanks very much. Again, I do also want to say thank you to the community members who come out. I tried, as I answered several emails over the last couple of weeks, to explain that we are always open to your feedback and input. I should mention, someone did bring up the way in which we address feedback. And last Wednesday at the finance meeting, I did ask Mr. Robsky, one of our board members, to address the communication that he had had with a community member, which we as a board felt was inappropriate. And he did issue a public apology. And for those members of the community who were not on that call, I wanted to make you aware of that and express for one last time, or not the last time, once again, that my expectation as board president is that we operate with the highest level of civility and respect. We are not robots. We are under incredible amounts of stress, just like everyone else. I try to keep a pretty poker face up here, but it's very difficult. And there were missteps. but my expectation is that will be resolved going forward. We are going to always strive to do better. And if further action is warranted in the future, we will take it. That being said, I would now like to ask Mr. Leckman for any announcements or communications.
There are none this evening.
Thank you. Do we have minutes this evening?
Yeah, so included for the board's action tonight is item A, which are the minutes from the August 24th legislative meeting. Item B is our committee minutes, and they are for information only.
Thank you very much. Those items were reviewed at previous committee meetings, but the community should be made aware. Now we're going to move on to our committee reports, yes?
We didn't vote on the legislative minutes.
Oh, I'm sorry. When he had said information item, I made that mistake. Indeed. Do I have a motion to approve our August legislative meeting minutes?
So moved.
Second.
Thank you. A second. Thank you, Dr. Lemanowitz. All in favor of approving the August 24th minutes, please say aye.
Aye.
Any opposed? Thank you. The item is passed. And again, the committee minutes from August are information. Now on to our committee recommendations. Mrs. Sherpier, Education Committee.
Yeah, thank you, Mrs. Franzek. We have a number of items for the Education Committee from the Education Committee meeting, but we also have 3 new items. So I would like to take a moment to look at those first. Item E is the Edpuzzle 1-year limited teacher access to support the academy activities. Then there is the student activities item and the courses over the class guidelines. So perhaps Mr. Hoffman, if you want to say anything about the Edpuzzle.
Hi, yes. The Edpuzzle is something that our teachers are currently using, the free version of. The Edpuzzle Pro subscription, I don't know if it's called Pro subscription. The Edpuzzle, the paid membership subscription will allow unlimited storage and unlimited videos for our teachers. What Edpuzzle does is you can use an educational video clip that you find or that you create on your own, and you can embed questions along the way for teachers to check understanding. Teachers can also monitor, hold that accountability piece for students to know that they are seeing it, that they are engaging with it.
Looks like
Mr. Hoffman, I think we lost you. If you could perhaps shut your camera and see if that brings you back.
I can jump in.
Thank you so much, Mrs. Penner.
Yes,
Mr. Hoffman, you were frozen for a bit.
Mrs. Penner, can you jump in and speak to that item, please?
Yep. So we're really intentional with teachers about asking them only to consider new tools if there's truly a need. And Edpuzzle has been something that's been on our radar since probably midsummer when we rolled out the Catlin Tucker work and the global online learning. So this is something that they feel is a little bit different than Flipgrid. I know my own 8th grader said to me, Mom, I'm done with Flipgrid already. So we want to have a variety in the tools that we're allowing teachers to use. And we also recognize that our teachers are all at different levels of, their own skill sets with some of these tools. So we think Edpuzzle will really provide us the opportunity to differentiate and get important information and provide meaningful feedback to kids.
Yeah, thank you, Mrs. Penner. And I think from as a teacher myself, I'm using this also. And one of the good things about Edpuzzle is that every student will participate and respond to a question being asked, as opposed to maybe one kid in a class. Edpuzzle encourages engagement with everyone. So I certainly can attest to its benefit. let's talk about the student activities, which is in this case the high school trip. I don't know, is there anybody who wants to, from the administration, who wants to address that?
Mrs. Sherpier, you were breaking up. I didn't catch the last part of what you said.
I just wanted to hear if there was anybody from the administration who could address that trip, because to be honest, I'm a little surprised to see that on the agenda at the moment.
Yes, I believe I see Dr. Callahan's hand raised. Dr. Callahan, can you go ahead and I'm going to promote you to panelist, and then could you please address that question?
Good evening, everyone. I would like very much to address the question. Certainly appreciate being on the agenda tonight. The senior class trip is slated for April 23rd, 2021. We have been very confident in our dealings with World Class Vacations and having a 100% monetary refund on student amount being paid should there be a CDC travel ban to Florida, similar to, unfortunately, the 2020 senior class trip. Just Friday, I had the opportunity to speak with the CEO of World Class Travel, and he additionally said that if in fact there is even the slightest bit of recommendation not to travel to Florida, then they would in fact give 100% total refund to our students as well. In addition to that, there will be no penalty for any kind of cancellation mid-December. I have also assured that students can purchase individual insurance up into mid-December and get back at least 75% of the monetary total value if in fact even there's no CDC ban or recommendation.
All right, so that's the class trip, and then the last one is the courses over the class size guidelines. And then once we have heard about those, then we'll have open up for committee members and board members to ask questions.
So I've addressed I've addressed the elementary, the middle school and high school. This list is far shorter than in previous years. There's a one section of pre-algebra, and that section may actually come under the class size guideline. And there are a number of singleton classes at the high school, AP Calculus being one of them, Health being one, Phys Ed being one, and Phys Ed electives. But I'm comfortable recommending these for approval tonight.
All right, thank you, Dr. Yanni. At this point, are there any questions from the board, especially the education committee members first, and then the rest of the board? I see Ms. Ionetti, so please go ahead.
Yes. Is there a reason we have to, or we're talking about Disney, like you sort of asked this, but do we have to decide tonight on the Disney thing? Can it wait a month? It has to be, is there some, like in order to get at that deal, it has to be tonight?
Mid-October, they would like the first deposit. We do have about 50-55 students that have already given a deposit. Certainly that's low for now, but that's also because we're waiting for approval. So certainly tonight would be, I think, we would be on schedule for that. However, as you can imagine, our seniors are very excited, and if it means that the board needs some time to think about this, then certainly we can wait a month. But if you are asking, tonight would be a wonderful time to decide, but certainly we can wait a month.
All right. Anybody else from the education committee? If not, then Mr. Henderson, go ahead.
Hi, my question was pretty much the same as Ms. Ionetti's. If we had to make a decision this evening, since this is the first time we're hearing about this opportunity. So Thank you.
Thank you, Mr. Henderson. Anybody else? Yes, I agree on the senior trip. I think our focus should be on opening schools, get kids to schools. I know the seniors are very excited about the trip, and I certainly hope we can make that work. But I believe at this point, it's premature to talk about that trip if we haven't even gotten kids back in school. So for me personally, that feels that this is a little premature, and I would suggest we have another we return to this item at a later date. Oh, I see Dr. Levinowitz's hand came up. So Dr. Levinowitz, go ahead.
I think we have a couple of options here, Ms. Sherpier. One is to table the motion. And if we do get enough votes to table, we put it off for a month, or have a vote, take that item separately from the rest of the Education Committee and have a vote tonight. I don't see why we should put it off or not vote for it. If we're guaranteed to get 100% refund, we can move forward with it tonight. That's my opinion, but I could be in the minority of the board, and we need to find that out.
Yes, is there anybody on? Oh, I see a couple more hands go up. Ms. Iannetti?
Yeah, my reason to want to table it is, you know, we have every day we get new information, and even though it says we get our money back, that there's a high standard we have to meet to get that money back, and it might be we might be in between there, and I think I need more time to think about this. That's it.
All right, Mr. Sirota?
Thank you. And Dr. Callahan, please correct me if I get this wrong, but my understanding is that the cost to the district here is only the cost of the substitute, which is listed on the sheet as $2,600. So the money we're talking about for the district putting at risk actually is none at this time, because we don't actually incur that cost until we need the substitute. So what we're really talking about is preserving the option for students or families to get their deposits back, or potentially more than deposits, depending on the timing. Again, like the other decisions, I don't see a reason for us to take that choice away. They can, if they choose, delay the opportunity to submit their deposit or pay late fees if they, don't want the early birds pricing. So I'm inclined to go ahead and vote now. Normally we would be having this discussion after the motion had already been made, in fact.
Correct. All right, thank you, Mr. Sirota. Dr. Levinowitz? No hand, the hand left. Okay, then I think let's take all the items apart from the student activities, and let's take all those together since they were discussed, and then we can do a separate vote on the student activities.
Sure.
Does that seem consistent?
It does.
All right.
So,
okay, so then I would like to recommend that we approve items A through E and G, and I'm going to ask there to be a second for this motion.
Second.
I hear a second. I thought I heard Dr. Davis in the background, although your microphone is very muted.
yes, that's fine.
Okay, so all in favor for items A through E and G, please say aye.
Aye.
Aye. And anybody opposed? Hearing none, then I think those items A through E and G are approved. Then let's go to the student activities. Let's see. get the full wording of that motion.
Well,
Can
again, we
you-
have a couple of different options. Any board member can make a motion to table, and it would require a second. Mr. Biasio, do you want to chime in here?
Yes, that's correct. So at this point, any board member can make a motion. The motion could be for approval of the item. The motion could be to table the item, to a future date. At either motion would need a second. Then there can be board discussion on the merits, and then a vote can be taken.
I'd like to make a motion,
Ms.
if I
Frantek.
might. I'd like to make a motion to approve item F, student activities. Do I have a second?
Second.
So now we may have discussion about whether or not we think this is appropriate at this time. My rationale for going ahead with the motion, actually just read an article. I can't cite the source exactly. I'll probably go back and find it, about the notion of looking forward to something, particular travel, that it's actually a very primal thing for individuals for their mental health. I think given the financial out clause, so to speak, that Dr. Callahan has described, and the limited financial risk to the district, it is my hope that we can, at least for now, move this forward, knowing that anything and everything can change.
All right. Are there other members of the board who want to speak to this? Thank you, Ms. Frantek. All right, then let's take a vote on this. All in favor of providing the student activities to move forward as stated in the agenda? All in favor, say aye.
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 Anyone opposed? I will be opposed because I totally agree with having something to look forward to. I do feel that it is premature at this point to plan a trip that includes a fair amount of money. Students, seniors, are in a position at the moment, if they want to start raising their money, we will do everything we can from my perspective to make it work. But at this point, I think it's just too premature. So I would vote no.
All right. I heard 8 yes and 1 no. Therefore, the motion has passed.
Correct.
Thank you, Mrs. Sherpier. And I guess you're still on the floor. No items under technology recommendations, but under education, I'm sorry, under student services.
Right, and under student services, we have items A through J. All of them were discussed in the education committee. So if there are if there's anybody who wants to make a comment on any board member who wants to make a comment, we can do that. Otherwise, I would like to take all of these together. Not seeing any hands, so I would like to propose a motion to move items A through J, sorry, from item 10 for approval, for a vote to the board. Is there a second?
Second.
Dr. Davis is a second, so all in favor, please say aye.
Aye.
Aye. Anybody against? Hearing none, so all items pass.
Thank you. Thanks very much. Moving on to Finance Committee, Mr. Schroeder.
Thank you. This will be simpler. We have 7 items under the Finance Committee recommendations. All 7 were discussed in detail at the Finance Committee last week. So I would like to make a motion to approve all 7.
Do I have a second? Do I have a second from anyone on finance? Thank you, Mr. Robsky. And any comments or questions? Indeed, these items were covered in depth, and I was very appreciative of the robust conversation at the Finance Committee on Wednesday, and Mr. Lester and Mr. Leckman's thorough information sharing. So thank you to both of them. That being said, we have a motion and a second. All in favor of items A through J, please say aye.
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 Any opposed? The items have passed. Thank you, Mr. Sirota. Personnel, Dr. Levinowitz.
Personnel, we have 4 items tonight. A is some additional furloughs. I believe there's 4 or 5 adjustments that needed to be made. B and C are items that are generally done at this time of year. They're nothing new, but they are done on a yearly basis. And D's are regular personnel report. So I'd like to make a motion that we move all 4 of those items forward.
Second.
Thank you, Mr. Sirota. Comments or questions? Okay, seeing none.
Actually, I have a comment.
Oh, I'm sorry. I'm sorry. You are hidden from my screen. Go ahead, please. Oh, now you're muted.
Fly under the radar here.
No.
I just would wonder if it would be helpful to our people in the audience to understand why furloughs might be happening, while we also hope to bring perhaps some people back as we try and open schools.
So there are different job classifications, and in the UDESPA contract, furloughs and recalls happen by job classification. And so therefore, in a certain job classification, there may be furloughs while at the same time we're bringing other people in other job classifications back.
Thank you. All right, thank you for the clarification. All in favor of the approval of items A through D under personnel, please say aye.
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 Any opposed? Thank you. The items have passed. Policy, Mr. Wallach.
Thank you, Ms. Franczyk. We have second readings and first readings, all of which were discussed at Policy Committee. There's a couple informational items that are associated with each one, which I'll cover in the context of my 2 motions. First, the policies for second reading. We have Policy 103, which is non-discrimination in school and classroom practices, 146, trauma-informed approach, and 247, hazing. Item A, the informational item, is that our current Policy 103 will be renumbered as Policy 103.1, as we had discussed this at the Policy Committee meeting. In order to continue to capture the equity component of that policy, the balance of the policy will be replaced and superseded by new Policy 103 if approved tonight. So I'll make a motion to approve item B, the second readings on the agenda.
Second.
Thank you, Mr. Sirota. Any comments or questions on the Policy Committee recommendations? Just for the members of the community who are on this evening who may not always be on a legislative call, this year we moved our Policy Committee work to the evenings, and I'm very, very pleased with the dialogue that we've been having. In particular, of late, Title IX has been updated to, or really our response to Title IX has changed, and we are really stepping up. I wanted to thank the administration and Mr. Wallach for their continued collaboration regarding how we address these really important issues. Very, very critical to us in our equity work and in our safety work, that we are keeping everyone in the district safe. So thank you to all of you for that work. Now that I have, I'm sorry, Mr. Wallach.
No, I was just going to keep moving, but please continue.
Yeah, rock and roll. Are we ready to vote?
We are on item
Awesome.
B.
Just item B. Okay. We have a motion, I believe, in a second. Yes. Correct. And so all in favor of approving item B, please say aye.
Aye. Jeff?
A is just informational.
Okay, I got you.
It's just B.
Thank you.
Thank you. So all in favor, please say aye.
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 Thank you. Any opposed? All right, the item has passed. Other items, Mr. Wallach.
Sure. I'm going to take items C and D together. Item C is our first readings of 4 policies: 249, bullying, cyberbullying; 256, dating violence; 317, conduct disciplinary procedures for employees; and 824, maintaining appropriate boundaries with students. All of those were discussed at our policy committee meeting. Item D, we didn't expressly address at the policy committee meeting, but it will be a repeal of policies 417 and 517 as we are consolidating policies into the employee part of the policy manual. They will be covered in new policy 317 eventually as that gets through the process. So I'll make a motion to approve items C and D on the agenda.
Second.
Thank you, Mr. Sirota. Any comments or questions? All right, seeing none. All in favor of C and D, please say aye.
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 Any opposed? All right, the items have passed. I'm going to turn it over to Dr. Darlene Davis to cover our items under other business, please.
Thank you. There are 7 items under other business. I'm going to take each of them individually. So for A, we have a donation of an Apple Mac Mini. I'm making a motion to accept the donation of the Apple Mac Mini, the monitor, and accessories for the UDHS Allied Arts. The monetary value is $2,829.26.
Thank you. Do I have a second?
Second.
Thank you, Dr. Levinowitz. Any comments or questions regarding A?
Just that we need to acknowledge and thank the individual or group that's donating the machine, and I think it'll be it'll go to great use.
Great. And do we know that at this moment, the individual or group, or was that anonymous?
I believe the individual has to be anonymous.
Very good. Well, we thank them from afar. We do appreciate it. All in favor of approving the donation, please say aye.
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 Any opposed? Thank you. Item A is approved. Dr. Davis?
Okay, the second item is for the election of Pennsylvania School Boards Association officers. Tonight, I'm recommending that for president-elect, we have David Hine. For vice president, Sabrina Backer. For treasurer, Michael Gossard. Also, we need to vote on the trustees, and I'm scrolling down. The 2 trustees are Michael Fascinetto and Marion Neal. And then finally, we also have the Forum Steering Committee, Stephen Scrocky and Tracy Long. We're recommending that those individual be voted on for the officers, the candidates for PSBA.
Very good. Do I have a second?
Just clarification, we don't do the school board secretaries forum. We don't vote for that.
Oh, all right. Very good. So those last 2 individuals.
By board secretary separately.
Okay. Very good.
Okay.
Thank you for the clarification. I think I heard several seconds.
I second.
Okay. Thank you, Mr. Henderson. Any comments or questions from the board? All right. Seeing none, may I have a vote? All in favor, please say aye.
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 Any opposed? Thank you. And we wish those candidates good luck, and we wish Dr. Levinowitz good luck in working as PSBA president next year with those candidates, hopefully successful candidates. Next, we have item C, Dr. Davis.
C is a motion to authorize.
Dr. Davis, I apologize. I see Ms. Iannidi's hand. Is that for the next item?
Yes.
Apologies. Thank you. Sorry to interrupt. Go on.
Okay. C is to resume in-person instruction, full-time special education students. This is a motion to authorize the administration to resume the in-person instruction for Wait, for C, it's for kindergarten. I'm sorry, because the next one is special ed.
That's
C
right.
is for the kindergarten students to resume in-person instruction effective Monday, October 5th, 2020.
That's correct. Second?
Second.
Thank you, Mr. Sirota. Comments or questions? Ms. Ionity.
Yes, so before this vote, I just want to say a few things. I'll try and keep it quick. There is so much that I like about what the administration is doing here. They're easing us in. We're not starting off with lunch, which is a trickier situation. They're doing a great job with getting the information out to families about what the class sizes will look like, what the ventilation situation is, and the social distancing measures that will be in place. So parents have that information before they have to make that decision. So I am thrilled about that. I do want parents to have the choice, and I know this virtual situation, especially for kindergartners, is extremely difficult. But I'm still not comfortable with the distancing in the class and the number of people in the class. So I want that choice, but I'm looking at the Pennsylvania Department of Education, what they recommend, what Montgomery County recommends, and I know it's a little bit up to interpretation, and it's hard to meet everything they want us to do. But for that, I'm going to vote no on this kindergarten situation.
Oh, sorry, I was muted. Mr. Sirota?
I would like to echo the first part of that. I'm very appreciative of the hard work that's gone into planning for this and making as much information available to families before they need to make a decision whether to stay in Cardinal Academy or send their kids in. And I'm also appreciative that the recommendation starts with the neediest kids, as I believe the youngest kids, and of course the full-time special ed kids have sort of drawn the shortest straw with regard to education in the age of COVID-19. So I'm going to vote for this, and I do hope it is just a beginning. So I hope this doesn't end here. I'm appreciative of this start, and I hope this passes and we can keep the momentum up. Thank you.
Thank you, Mrs. Sherpier.
Yeah, I'm going to vote in favor of this. I think it's important for students to be back in school, but I'm also very appreciative that the opportunity for parents who want their kids to stay at home to continue with the Cardinal Academy. I expect there are going to be lots of questions from parents, and I'm going to ask the parents direct those questions to the principals initially, and then on to the line of command, so that those can be addressed at the building level whenever possible.
Thank you, Mrs. Sherpier. Dr. Davis.
I too am going to support this motion. I do believe it is important for us to get our kids back, and as Mr. Sirota mentioned, I'm hoping that this is just the beginning and we can continue to move forward. I'm happy that, in our county, we have rapid testing now. We have things in place for, contact tracing. So I think that we're in a good position to begin to bring our students back and then use the protocols that are in place if indeed we do have a case.
Thank you. Mr. Robsky?
Yes, I want to make sure that our transportation department will be up and running, ready to bus transport our students as well as the private school students. I guess since the kindergarten will be going half day, will the busing of private school students be full day? I just want to make sure that's clear and all the safety precautions are in place.
Thank you, Mr. Henderson.
I also will be supporting this measure. I think, I want to again thank Dr. Yanni and his team for working collaboratively with the board, listening, getting feedback from our parents. I think that this measure and item D is a reflection of the fact that we as a team are listening. I think this is our first time that we've gone to a virtual teaching model. When we are, like we said, there's no one who knows the playbook for this. Obviously, over the first couple of weeks, we've seen there's significant challenges with our special eds kids and our kindergarten kids in virtual. So this gives an opportunity for us to be to work responsively with our parents. But most importantly, everyone in the administration and the school board wants our kids to be in person in school, but we want to balance that with making sure that it's done safely and balancing both. So again, I support this too.
Thank you, Mr. Henderson. Dr. Levinowitz.
I just want to reiterate some of the statements made. Just to remind the community that when these decisions are made, each board member spends a good amount of time, working with Dr. Yanni and the leadership team on asking questions and moving when we. And I prefer moving small steps right now, kindergarten, and the worst thing that can happen, I believe Dr. Yanni mentioned this already, is if we bring a lot of students back and we have cases in the building and then we're back to zero. So I really think this is a first step, and I look forward to bringing students back safely and safely, working with county, working with state, and working with the other districts. So we're all planning out these next steps over the next few months.
Thank you. Mr. Wallach.
Thank you. I too support this recommendation. I'd also like to echo some of the comments made to thank the administration and everyone for bringing this forward tonight. I hope it's productive and safe and bears fruit, and I hope it is a harbinger of other potential efforts that we're able to do in the future.
Thank you very much. I will also be supporting this effort. Great amount of time and effort has gone into adjusting, reacting to new and improved data, and working to communicate with as much information as possible to the community so that everyone can make the best decision possible. We are not in for easy days ahead. There are going to be difficulties with this, just like virtual, but I know that the way that we have rallied together will continue to be the way that we have rallied together. So that being said, I believe I have a motion. I believe I have a second. We have had our discussion, and now it is time for the official vote. All in favor of the resumption of in-person instruction for kindergarten, item C, please say aye.
Aye.
Aye. Any opposed?
Nay.
Thank you. The vote is 8-1 in favor of the resumption. The item has passed. Dr. Davis, now on to item D.
D, very similar to C, we are asking for a motion to authorize the administration to resume in-person instruction for full-time special education students effective Monday, October 5th, 2020.
Thank you. Do I have a second?
Second.
Second.
Mr. Sirota, thank you. Oh, he just beat you, Mrs. Shrippier. Next time. If I could open the floor for comments and questions. Ms. Iannitti?
Yes. This plan, these students desperately need to be in here, and there's less of them in the room. So I feel like it's a much safer approach, and I will support this motion.
Thank you. Do I have any other board members who would like to speak or make a comment? Okay, seeing none, I'd like to hold our vote. All in favor of item D, please say aye.
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 Any opposed? 9-0. We will be approving item D. Dr. Davis, item E.
Item E is regarding non-public and public student transportation. Making a motion to resume transportation for our non-public and public students effective October 5th, 2020.
Do I have a second?
Second.
Second.
Oh, I'm sorry. I should have let Ms. Sherpier do it.
Oh, that's right.
How quickly we forget. It's all right. She'll get you next time. Comments or questions from the board? All right, seeing none. All in favor of this item, please say aye.
Aye.
Aye. Any opposed? Seeing none, the item has passed. Item F, Dr. Davis.
Item F is in regards to staff recall. I'm making a motion to authorize the administration to recall furloughed employees to the extent necessary to resume in-person instruction and provide transportation.
Second.
There she is. Well done. We've got it now. Any comments or questions from the board? All right, seeing none, all in favor, please say aye.
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 Any opposed? Thank you. The item has passed. Last one, Dr. Davis.
Okay, the final item under other business is the memorandum of agreement. This is a recommendation to approve the attached memorandum of agreement, providing direction for the recall of furloughed support staff.
Second.
Second.
Thank you, Mr. Sirota. Any comments or questions? All right, seeing none, all in favor, please say aye.
Aye.
Any opposed? Thank you. The item has passed. Thank you, everyone, for bearing with us. We are going to now move on to our liaison committee reports. The school board of directors, we interface with a variety of outside organizations and some internal as well. We have the report for this month as an attachment that you can take a look at. I would invite, if anyone has a special announcement regarding the organization they're working with, to raise your hand so we can address that. Mrs. Sherpier.
Yeah, I just received a message from the Educational Advisory Committee. They're regrouping this month and hope to have materials to share with the board next month.
Thank you. Any other board members? All right, seeing none, please refer to our report. They're somewhat limited right now. Many of these committees and organizations are just getting back up and running for the year. All right, Mr. Diazio, the solicitor's report this evening.
Yes, thank you. The solicitor's report this evening will be an announcement of the executive sessions since the last legislative board meeting. There was an executive session held on September 9th, 2020 regarding the topic of school safety. And then there was a second executive session immediately prior to the public meeting this evening to discuss matters of personnel that were on the personnel agenda this evening, as well as one item regarding agreements involving the support staff. That concludes my report. Thank you.
Thank you, Mr. Diazio. Now I'd like to move into our second opportunity for public input, or for community input rather. I will ask folks to raise their hands. While we're waiting for folks to do that, Mr. Diazio, I believe you have two comments that were written in advance.
Yes, I will go ahead and read those two comments. The first one comes from Mary Ann Colbrenner from Ambler. The comment reads, "First, I would like to thank you all for supporting our student athletes. It is refreshing to see all of the activity happening at the high school athletic fields. My question is regarding House Bill 2787, which would give individual school districts the authority to set safe, appropriate limits for indoor and outdoor athletic events. Would spectator limits be reconsidered if Governor Wolf's veto of the bill is overturned? Thank you." And the second comment comes from Bill Brown of Drescher. And the comment has a number of points here. Number one, when will Spanish 3 and Spanish 4 teacher be hired for the high school? Students used an elective slot and deserve to have a teacher. Number two, please ensure small ensemble performing arts ensembles ASAP. Sports have resumed. The arts deserve an equal opportunity. Number 3 says Zoom is often problematic on students' Chromebooks. My son switched to a laptop to be able to participate in 3 of his classes. Number 4 reads, the teachers are trying to make the best of this, but it is really lacking and inferior to in-person instruction. We are pursuing tutoring that is necessary solely because the intended synchronous learning is in practicality too similar to asynchronous busy work. Please proceed to in-person learning as soon as possible. Thank you. I kept my comments short out of respect for your time.
Thank you, Mr. Diazio, and community members who provided written comments. I'm now going to move over to our waiting room and Sarah Popkin.
Hello, I'm Sarah Popkin from Drescher. I want to thank the board for moving in the direction of supporting parent choice. I apologize if this was addressed and I missed it when putting my 5-year-old to bed, but I just wanted to hear about the rationale for bringing kindergartners back only half day. We've made many adjustments, like many families, financial and otherwise, to help our kindergartner, including adjusting our schedules to reflect a 2:45 p.m. end of day. I'm just hoping for some clarification of the thought process, and I'm hoping it is more than the challenge presented by eating lunch. Thank you.
Thank you. May I have Sarah Popkin? I'm sorry, that was who we just had. Apologies. Brittany McKenna.
Thank you. I just wanted to say that the teachers and the administration have done an incredible job, in my opinion. And it's the parent, the staff is working well beyond the school day to make sure that our children are getting the best education possible, despite a variety of obstacles. My question is, upon returning to in-person learning for kindergarten, who will teach the students who remain in Cardinal Academy? And at some point, assuming that more grades will begin to attend in person, at some point numbers will go up. It's inevitable. When we return and when teachers get sick or take leave, which is their right, do we have substitutes ready to fill vacancies? Or will Upper Dublin have to hire emergency certified staff with no formal teacher education training, as some neighboring districts have done? Answers to those questions may affect our family's decision to return to brick and mortar and should be considered when sending out the survey to the community. Thank you for your time.
Thank you. Jenna Evans.
Hi, Jenna Evans again from Drescher. So I'm just weighing in again on the class size issue. So I did ask that the board approve it, so I guess I'm happy. But to be clear, I never thought anything nefarious was going on. And I do appreciate Dr. Yanni's clarification that some of these students will move to full-time special ed instruction. However, now that Dr. Yanni has also clarified that teachers will not be teaching both in person and virtual, kind of at the same time, I guess my concern here is just for, that point in time when they do return to in-person instruction, or at least when some do, unless we get exceedingly lucky and the exact right amount of students happen to choose either option, you're going to have this class size problem in, a month and a half, assuming we go back on November 9th. So I want to make sure that folks are planning for it. I'm sure you are. You're all very smart. But I'm really concerned. I don't want to see this problem get worse when they do return. And I don't want to see us have to scramble and, hire a long-term substitute. I'm hoping that we're preparing for this now. I trust we are. So that's all I got to say about it. Thank you.
Thank you. Lisa Barry.
Hi, good evening again. I again wanted to thank the board, like everyone else, for taking steps to move forward and not backwards or staying stagnant in our situation. I also want to ask, many parents have asked what happens now. So for the first graders, the second graders, all the way through 12th, I understand that there's the blueprint presented by Dr. Yanni, but are we going to wait a week in between bringing back more kids, 2 weeks, 3 weeks? What happens from here? And following up what Ms. Evans just said, regardless of the fourth grade classes, just for all the classes, what happens if you have 4 teachers and 60% of the kids decide to come back in person? then do the 40% go to 2 teachers and the 60% go to the 2 in person? I mean, the numbers aren't going to work out perfectly. So I'm wondering how that's going to work with having classes that are consistently sized, with having certain kids out, certain kids in, certain teachers out, and certain teachers in. I would just be fearful that there's in-person classes that have 20 kids or 25, and then you have some virtual classes that have 15, or vice versa. So I'm wondering how that's going to work out with the staff ratio, or the staff percentage coming back and the student population coming back if those ratios don't align up. And that was all. Thank you so much.
Thank you. Kelly Williams.
Hi, sorry, learning technology as we speak. I'm Kelly Williams and in Fort Washington Elementary School, and I have a kindergartner, and I just want to say, and I apologize if I get really emotional during this, I just want to say that I really appreciate that you guys reevaluating this and allowing the opportunity for the youngest students who may be having the hardest time to come in, try it out, see what in person is like, allow them to have the opportunity to love school again while not sitting on the computer screens for 8 hours or 6 hours or whatever it is a day. With that said, I know parents have said this, and I want to reiterate this immensely, is that I can only speak for Fort Washington Elementary, but the staff there has been amazing, to Mr. Macular, to Jenny Heist, to Ms. Simpson, to Ms. Einhorn, to Mr. Green, to Mr. Dean, to the, I'm sure, a million other staff members, my kids' teachers, Ms. Young, Ms. Weinmayer, who have really, I would say in our entire community's opinion, has done an incredible job of trying to make this school year look somewhat normal virtually. I did have a couple questions. In the event, I don't have a 12th grader, I have a 2nd grader and a kindergartner, but in the event of the discussion for the student activities with the senior trip, I was just curious about whether or not there had been a discussion of whether to poll the students or poll the families to see, I mean, obviously you voted on it, but just to kind of gather community input on what they would like to do or how they would see fit, if they're willing to put money forward or compensate. Just another, I think just from what I'm hearing is that a lot of parents just want to be included in a lot of these decisions. So I was just had a question about that. And then, or maybe not a question. The other question that I wanted to ask was that it's been discussed multiple times about the state or Montgomery County of the guidelines that we're supposed to be following. And I just wanted to ask about whether or not we are taking those as guidelines or we're taking those as law. So in the event that kids can't be 6 feet apart, in the event that, I know Dr. Yanni, who thank you for all that you're doing, mentioned about proper air quality in some of the elementary buildings, is that, in my opinion, those are all guidelines. So I was just wondering how fact you're taking that into consideration of the other grades moving forward, coming back in, and obviously trying your best. But if it can't be met, is that no one goes back to school until the guidelines can be met, etc. So anyways, I just want to reiterate, thank you for everything. Thank you for reconsidering. Just thank you.
Oops, my apologies. Thank you. Jenny Vitella.
Hi, Jenny Vitella Ambler. I want to thank all the community members for speaking. At the beginning, I was in the car with my daughter and I said, oh, I don't even have to talk tonight. I'm sure everyone's thrilled. And she said, please talk, because I want them to know how much I want to go back to school. That is my 6th grader. I want to say I'm thankful that we're sending our special education students and our kindergarten students back sooner rather than later. I think a nice next group would include the rest of 1 and 2, and then specifically 6th grade, their transition year. We've discussed at multiple meetings over multiple years how difficult 6th grade transition is. Now these kids are in a Zoom meeting or a Google Meet with a class of 25, and they know only maybe 5 of those kids because they haven't been in school with them. They've already missed out on multitude of activities at the beginning of the school year that they normally would do. And they desperately need to get back in. And if they are the first ones to get back, they'd be the only ones back in Sandy Run, right? So we would have more space. Then I would think that also 9th and 12th. 9th, also a transition year. They've also missed on welcoming back into a big school, into high school, an important time in their life. And the seniors, gosh, we can't take any more away from these seniors. We need to get these kids back. I obviously want all the kids back, but I know other districts have done K-2, 6, 9, and 12. And whether we have a lot of kids for kindergarten going back wouldn't make any difference whether 6th grade went back. It's a totally different building. So they should be sort of looked at differently as a different pot of group. It's not like, oh, we're sending 200 kids back. No, we're sending 200 kids back between 6 buildings, right? So please consider, I know you're moving methodically. This is a good first step, but please, all these kids, and so many people spoke tonight pleading for that choice to parents and the kids, get that choice back. That is so important. And especially these transition years and our poor seniors. Thank you very much.
Thank you. Susan Torrison.
Yes, good evening again. Thank you. Susan Torrison from Maple Glen. I'm very grateful that the private schools will get busing, but I kind of feel that it's just because kindergarten is going back, but I won't be ungrateful for that. But hypothetically, and just covering my bases, God forbid it doesn't work out for kindergarten for whatever reason, does that mean we would lose our busing? So just curious about that, but I am grateful. So thank you that kindergarten is going back and private school will get busing. Thank you.
That sticky mute button. Thank you very much. Seeing no other individuals, we are finished with public comment. I would like to move now to comments from other board members and the superintendent. Dr. Yanni, we can start with you.
Thank you, Mrs. Franczyk. So one of the things that we will continue to monitor as we receive the numbers back of how many students are going to remain in the Cardinal Academy and how many students are going to come back for in-person instruction, we will do what we can to balance the classes. There may be an imbalance, as it was described, between either in-person and virtual, where a class might have 22 and another class might have 15. We will be watching the class size guidelines, though, so we will be very careful about that. The numbers will also dictate if we're able to bring everyone back or if we have to enact a hybrid approach. So we want everyone to just understand that we're not going to intentionally create some imbalance in classes, but there could be disparities depending upon the numbers that come back. But we will absolutely communicate that as we move forward. A couple of the other questions. We will be sharing information in tomorrow's Touch Base Tuesday about what the school day will look and feel like when we bring students back. And I'm sorry, I clicked out of my notes page here. The other thing that we will be doing as we survey not just kindergarten, but 1st through 12th grade, last week in our newsletter, we included a frequently asked questions document that we'll be sending out again, which goes through very specific information about every facet from social distancing in classrooms to ventilation to students working together and what have you. In terms of the senior class trip, I will check with the high school. I'm not sure if there's a polling process that goes on for the trip. My understanding is that the Disney trip is an annual trip. So I will circle back with everyone about that. And regarding non-public transportation, I don't see an issue with non-public transportation and kindergarten and special education students coming back unless we would move from the moderate transmission phase to the significant transition phase by the Department of Education. Should that happen, we will make that information known as soon as we receive it. But I do not anticipate that, nor does our local Department of Health anticipate that at this time. I don't know if Mr. Hoffman or Mrs. Penner would like to speak to any of the other topics that were discussed.
I think you covered everything I would add, Dr. Yanni.
Okay, very good. Thanks, Dr. Yanni. Mr. Rapsky?
Yes, a couple things. I've been having issues with my computer. Sometimes the voice works, sometimes it doesn't, but I just want to add that the Township and School District Liaison meeting is tentatively set for Tuesday, September 29th, and we did not meet in August. And second, I just want to thank you, Amy, for your leadership and appreciate all the hard work that you are doing to guide this board through these troubling times. Thank you.
Thank you, Mr. Rapsky. Mr. Sirota?
I would like to just say that, and Dr. Yanni hinted at this just now, I'm thrilled that we're able to begin resuming in-person instruction starting in October. And like I said, I hope we can do more. All of that is contingent on keeping COVID-19 numbers under control. And so it is really important that people don't hear this as good news and relax. You need to hear this as good news and be vigilant. Everybody needs to keep wearing their mask over both their nose and mouth, keeping your distance, washing your hands, making sure that your kids do that, make sure everybody does that, make sure your kids, by the time they get back in school, have found a mask that they're willing to wear all day. If the numbers, it's not up to us. It's up to everybody to keep the numbers in check. So please, everybody, do your part. Thank you.
Thank you, Mrs. Sherpier.
Yeah, I think Mr. Sirota said a lot of the things I was going to bring up. I do want to thank everybody for their input today. I do want to know that as a board, we receive input from a lot of people, and we do consider that. One thing is very clear: no one wants this pandemic. We all want kids back in school, but the data and the guidance we received over these last few months made us make the decisions that we made, and now the situation warrants a slow return to more in-person teaching. So let's keep up the good work, both in school but also outside of school, on sports fields and elsewhere in the township and elsewhere. So thank you very much, everyone, for doing what you do, and let's keep up the good work and have our kids back in school as much as possible, and our staff too.
Thank you, Mrs. Sherpier. Mr. Wallach?
Yeah, I just wanted to touch quickly on, there was a question raised about performing arts, and that presents so many even additional challenges to the many other challenges that we face in our district and frankly elsewhere in our society. But I did want to note that last week at the virtual town hall, Dr. Yanni mentioned that there are discussions ongoing about how we're going to address some of those issues for our performing arts students. So I just wanted to make sure that people realize that that's not a forgotten group of people here, and that activities outside of sports are definitely on the school district's radar, and we hope to provide for those types of activities as safely as possible when and if we can.
Thank you very much. Well, I want to just then, yes, oh, sorry, sure.
Then I neglected to respond to two things that I think are worth mentioning. I've been repeatedly asked by a number of people if we're short on teachers, will we be hiring folks with an emergency cert? You can only hire folks on an emergency certification if you declare an emergency. That means you can't find a certified teacher. So every attempt is always made to find appropriately certified teachers. So hiring teachers on an emergency certificate is really last resort. And also thinking about our kindergarten students and our students in special education, bringing them in for part of the day is to do two things: to ease them back into school and to also be able to test the functionality of returning to school. I know people don't like the lunch issue and think that might be an excuse. It's not an excuse. It's a real concern. So this allows us to test having kids back in the building in the safest way possible.
All right. I see no other hands raised at this time. I want to once again thank all of the members of the community who have attended this evening. I do see a hand on the attendees, so what I'm going to ask that individual to do, since community input is closed, please feel free to email Dr. Yanni or myself afterwards, and we'll address any question that you have. For everyone else, I just want to say thank you again. Your feedback, your comments are very valuable to us, and we look forward to continuing the momentum that we began here this evening and pushing forward in the most positive, safe, healthy, and sound way we can going forward. Our next upcoming meetings are Education Committee, Wednesday the 7th, October 7th at 6. Policy Committee will be right after that, same Zoom channel. Finance Committee, Wednesday, October 21st at 6 p.m. And our next legislative meeting, Monday, October 26th at 7 p.m. We have no other announcements at this point, as far as I know. So again, thank you, everyone. Have a good night. Stay safe and healthy. And this meeting is adjourned.
Thank you all. Good evening.
Thank you.
Good night.
All right.
Good night, everybody.